Hello, guys. Dr. Sara here. Am I audible? Hello, good evening, good evening. Hi. Let me just. Yeah, excited. I am excited as well. माता जी यार मेरी शादी भी नहीं हुई. Yeah, okay. Can you मेरी आईसाइट ना ऐसे थोड़ा इसको ऊपर कर दोगी तो और मुझे छोटा कर दोगी मैं बहुत बड़ी हूँ तो थोड़ा सा या Yeah, am I audible? Sorry. I'm just making sure that. Hello, guys. Hello, Shimpi. Hello, Shankar, Loyal, Mubarak Khan, Saif Ali, Abhishek, Aman. Yeah, hello, hi. I am Dr. Sara, and I'm so happy to see you at this moment. And I can see that you're all joining in. So before we start, let's get to know each other. I know we are 10 days away from the exam, but it's completely fine. देखो आपने सब कुछ करा है. Motivation भर भर के मिलेगा आपको ये session में, and I will make sure that we are throughout this journey. ठीक है? तो this is a session that is taken in two parts. Today you have one and another on 14th. Okay? So very high yield and whatever is very important. All right? Thank you so much. Is the audio fine? Please let me know if the audio is fine. And thank you, Loyal. I can see how loyal you are. Yeah, okay. So, yeah, good evening, just Julie. Good evening, Abra. I am so happy to be back and I am so happy to see you all. FMG aspirant, Naseem. Yeah, my mother is also here because apparently he has to come in all my sessions to support. But anyways, I am really happy to see you all. And yeah, before we start the session, do you have any doubts, queries that you want to ask me? Yes, I will be covering the most important. When is my birthday? How is that relevant? Yeah, okay, thank you. Yeah, I have cleared labs, so that is fine. Thank you so much. Thank you so much. Okay. Uh, so yes, please, questions bata दूं? Yeah, thank you, Paras, for coming in. Yeah, Pyruvate, you were waiting since December. Yeah. So yes, this session will be this PDF will be provided right after the session. All right. So do not worry. Everything will be given right after the session. Okay. Very good. How many hours? This will be around 2 to 3 hours. All right. We will have another session. Thank you, Paras, for showing up. Thank you. Paras is such a great friend, and I'm really happy that he has come here. Okay. Yes. Very good. So I'm happy you all joined in. Let's start with the first question now. See, and by the way, this is my Instagram ID. Do follow, do subscribe. I post questions almost daily. Okay, so let's see. Let's start with the first question now. Can you see this? A 45-year-old female presents to the endocrinology clinic with complaints of fatigue, muscle weakness, and bone pain. On examination, there is tenderness over the bones and renal stones are seen. All right? The test reveals hypercalcemia, PTH, and decreased phosphorus level. What do you think is the most likely diagnosis? We are doing a mixed bag. Yeah. We are doing a mixed bag, so we'll see as it goes. Okay? Yeah. All right. So, very good, everybody. Right. If you can see in the image, what is happening here on the radial side, can you see there is a subperiosteal resorption, right? Subperiosteal resorption on the radial side. As well, when you look at the, yes, very good. What is the answer here? It is hyperparathyroidism. And what kind is this? Is this primary or secondary? Can anybody tell me that? Clinically ज़्यादा है, don't worry. ठीक है, मैं चाहती हूँ you know the way to approach questions. That is the most important here, right? See, secondary will present with some kind of either hypocalcemia or like renal dystrophy, right? This is most likely primary hyperparathyroidism, right? This is primary. Okay, so let's look at the images of primary hyperparathyroidism. Remember, firstly, the most common cause of primary hyperparathyroidism is adenoma of the PTH. Hello, Jitendra. Hello, yeah, good. Good evening. Good evening. Good evening. Good evening. Very, very happy to see you all. I am very excited to take this session and seriously, बहुत देर के बाद मैं आ रही हूँ and I really wanted to meet you, get to, just be there with you till the end, right? So look at the images here. What do you see here? Firstly, when you look at the skull, do you remember the skull images that we have? Do you remember the skull images? See, because of the resorption, what happens here? What kind of Thank you. Thank you so much. Just continue with the session and thank you. Thank you so much. Just continue with the session. So what can you see? Because of the bone resorption, there is an appearance of salt and pepper skull, right? What is this? This is your salt and pepper skull, right? Salt and pepper skull. What about this? Remember, this is a very pathognomic finding of hyperparathyroidism where you have subperiosteal resorption on the radial side. Okay, subperiosteal resorption on the radial side. And if you can see what happens in the middle, there is because of the resorption in the middle. Okay, the end plates have become looks more sclerotic, right? This is known as rugger jersey spine. Can you tell me where is this seen? You remember renal osteodystrophy? You remember? Yes, and this is not your picture frame vertebra. I'll show you the picture frame vertebra. Can you see only the end plates are? Yes, renal osteodystrophy. This is seen in secondary hyperparathyroidism. Remember this. Okay? Secondary hyperparathyroidism. All right? Very good, very good. What about this? Multiple myeloma. What kind of skull do you see in multiple myeloma? Can you tell me what kind of skull do you think? See, guys, I'll tell you about the examination. The exam is you ask your seniors when they have cleared the exam, and you'll get the answer about which exam is easier. Also, remember, you're 10 days away from the exam. So, whether it's going to be easy or not, whether it's going to be anything, does not matter. The only thing in your hands is your own preparation, and I want you to focus on that alone. Okay? So, make sure that you are always revising well and taking care of that. Nothing else matters at this point. Okay, so yes, this is your raindrop skull. You see a raindrop skull here. And what about the raindrop skull? Yes, it shows you multiple lytic lesions, right? What about multiple myeloma? Can you tell me what is the issue here? What is the issue? There is an increase in immunoglobulins. Which kind of immunoglobulins? Yeah, plasma cell. It's a plasma cell disorder, and which immunoglobulins, if you remember, IgG more than IgA, right? IgG more than IgA. Okay, IgG more than IgA. Yes. So stay motivated. See, everything is going to be fine, right? So most commonly it involves your bones. Most common cause of death, can anybody tell me? It is infections because there is defective immunoglobulins, right? Most common cause of death is infections. Remember, you see what kind of calcification here? Metastatic calcification, all right? Where you have increase in serum calcium levels. And your beta-2 microglobulin is the most prognostic factor, all right? Most prognostic. When you see this, what is this? This is your stack of coin appearance, right? Stack of coin appearance. Right? Yeah, Rulix formation. Can you see? All the RBCs are forming in a stack of coin appearance. Yes, very good, very good. And you have this crab mnemonic. Remember, your multiple myeloma is seen in old people and you see these kind of findings. So this is very important for clinical questions, right? What is there? There is elevation of calcium, renal failure, anemia, because of decrease in erythropoietin, right? Decrease in erythropoietin and bony lytic lesions, right? Bony lytic lesions. ठीक है? Very good, very good. What about these bodies? Can anybody tell me what bodies these are? Good evening, Harshit. Good evening. Yeah. Can anybody tell me? Definitely, definitely. I will be giving you the PDF. So can you tell me first before we... Yeah, all right. So in the plasm, you see the Russell bodies, right? These are your Russell bodies. So they are intracytoplasmic. What about these ones? These are your intranuclear. What are these known as? Dutcher bodies, right? They are your Dutcher bodies. What about this one? If you see mott cells in a grape cluster of grape appearance, this is your mott cell, right? Yes, very good. These are your mott cells. Okay? These are your mott cells. Chalo, Dutcher deep nucleus. ठीक है. Very good, very good. All right. Thank you so much. Thank you so much. What about this on gel electrophoresis? What do you see on gel electrophoresis? Can anybody tell me? You see an increase in gamma globulins, right? Yeah. M spike. Yeah. Very good. Very good. And gamma. Very good. Very good. And what is this cell? The last cell that we have? This is your flame cell. Okay? Flame cell. So remember, multiple myeloma is that one question that is definitely going to come in your exam. So we cannot take a risk in that. And that's why I've kept all of the images there. Okay? जो important है with the images, it's all there in this PDF. You make sure to go through it ऐसे जल्दी जल्दी जाना. ठीक है? Okay, very good. What about your Paget's disease? Remember one thing, it is an abnormal activity of osteoclasts. So there are three phases, right? Osteoclasts increase, bone resorption happens, and then because of that, bone formation happens through osteoblasts, right? And yes, this is where you see the picture frame vertebrae. Very good, very good. What is the treatment? Bisphosphonates and calcitonin. All these points are very important, remember, they keep coming in the exam, okay? And in the lytic phase, what do you see in the lytic phase? These images are very important. You see a resorption that is flame-shaped, right? Flame-shaped, yeah, blade of grass appearance. What about your skull? You see resorption on the side. See, it's happening throughout. So that is known as osteoporosis circumscripta, right? Circumscripta. Can you see? These are happening. How many phases are there? The lytic, the mixed, and the blastic phases. So this happens in the lytic phase. Then when you look at the mixed phase, can you see what kind of skull do you see here? Can you see? Because of the resorption and the formation, there are cotton wool. This is known as the cotton wool skull, right? This is known as the cotton wool skull. All right? Can you appreciate, guys? PDF will be given after the session. Okay? What about this? Now look at the vertebrae here. Which vertebrae is this? This is your picture frame vertebrae. Can you see the dense sclerotic rim? Right, yes. This is your picture frame vertebrae. Picture frame vertebrae. All right? And what about this? This is your ivory vertebrae. Throughout there is sclerosis, right? So ivory vertebrae. Okay? And in the blastic phase, you see a diploic swelling, right? What is this swelling known as? This is the Tomo-Shanter skull. Okay? So these images, see, they're very, very important for the exam. You have your blade of grass appearance, osteoporosis circumscripta, cotton wool skull, your picture frame vertebrae, ivory vertebrae, and your Tomo-Shanter skull. These are the images. पेपर लीक कर दो, ये क्या बातें कर रहे हो? आप प्रॉब्लम में डालना चाहते हो मुझे? ठीक है. What about osteoporosis now? What about osteoporosis? See, remember there is a decrease in bone density here. What are the females that get osteoporosis? You know it is the postmenopausal female. Okay, it is very common in postmenopausal females because there is a decrease in estrogen levels. And estrogen is what? It is protective against osteoporosis, right? It is protective against osteoporosis. Definitely, what is the investigation of choice? It is your DEXA scan. Drug of choice, please remember, it is bisphosphonates. Do not ask again and again. Yes, terms are given, but the drug of choice is bisphosphonates. Okay? कमेंट्स भी देख लो, क्या क्या करना है कमेंट्स में मुझे? अच्छा, कुछ पॉइंट है? या वेरी गुड. Estrogen, estrogen inhibits osteoclast. Yeah. What about your T-score? When do you see it is osteoporosis? When it crosses the T-score of minus 2.5, right? Very, very important. Okay, on DEXA scan. Now look at this. Which kind of vertebrae is this? This is your fish mouth vertebrae. Because of the pressure, right? It becomes a fish mouth vertebrae. Where else do we see fish mouth? Does anybody remember? Fish mouth? Buttonhole, fish mouth appearance. Do you remember? कोई मुझे बता सकता है? Bhuvana, I'll text you later about it. Okay, yes, very good. It is seen in mitral stenosis. Yes, mitral stenosis. Yes, yes, very good. Mitral stenosis in rheumatic heart disease, right? Mitral stenosis in rheumatic heart disease. Remember, try to associate with other things, right? And also you have spine kyphosis here. Okay, so these are some very, very important points of the option that is given. So with one question, you can see we have solved almost 8 questions from one question itself, right? Very, very, very important. Let's go to the next question now. Can you read the question? See, this becomes very easy now. Do I need to see whenever we have some big clinical questions? When we have big clinical questions, what do? We look at the options and then the image and then the last line. Okay, always look at the last line. So they are asking you the diagnosis here, right? And when you look at the options and you look at the skull, you can see there are multiple bony lytic lesions, right? Do I need to read the entire question here? No, this is multiple myeloma, right? This is multiple myeloma. Very good, very good. Okay, this is your multiple myeloma. Now look at this. This is a pediatric question. तो हम वैसे ही सॉल्व करेंगे हर चीज. आई वॉन्ट अस टू लुक एट द ऑप्शंस, रीड अबाउट देम, एंड इंपॉर्टेंट ऑप्शंस आर इंपॉर्टेंट. ठीक है, अब ऑप्शंस के बारे में नहीं पढ़ा तो कैसे करेंगे, राइट? सो यू लुक एट दिस फीमेल, शी इज ऑन अ ट्राईसाइकिल, राइट? या वेरी गुड, वेरी गुड. तो ट्राईसाइकिल पे है, तो विच ईयर? सो दे आर आस्किंग यू व्हाट बेसिकली द ग्रॉस मोटर माइलस्टोन्स, right? Gross motor milestones. Do you remember your yeah, very good. इस बार तो look at this table here. This is very, very important for your gross motor milestones. Okay, before we talk about gross motor milestones, can anybody tell me what is the first time you get your fine motor skills? The month. ओके, एड ब्लॉक कैसे करवाऊँ मैं? ठीक है, मुझे पता, आई एम नॉट श्योर. आप प्रीमियम सब्सक्रिप्शन ले लो. या, कैन यू टेल मी? यस, वेरी गुड. सो बिफोर वी हैव योर what do you say, fine motor skills, you have something known as Palmer reflex, right? You have something known as Palmer reflex. Okay, and then at 3 months you start having, at around 4 months, right? Till 3 months you have Palmer reflex, and at 4 month you start having the bidextrous grip. This is very, very important because this was asked in your exam 3 times. Okay, bidextrous. What is a bidextrous grip? I'm going to hold it. ठीक है, कुछ दोनों हाथों से लेना. वो बच्चों को देखा है ऐसे ऐसे करते हुए, right? And then at the 6th month you have a unidextrous grip. Okay, at the 6th month. This is very, very important. All right, this is very, very, very important. At the 6th month you have a unidextrous. So these you remember, they're very, very important. Okay, so here you have your gross motor milestones. What about your gross motor milestones? Can you tell me about it? Yes. Okay. So at 3 months, see, it starts from cephalo and it goes caudal, right? 3 months, what happens? The baby starts getting the control of the head. You can also call it neck holding. Remember, this is the first milestone. This was also your previous year question. Okay. This was also your previous year question. What about 4 to 6 months? Now the baby can roll over. At 6 months, the baby starts sitting with support. Okay. And that is the point at 6 months when he gets a tripod position. Now, this is important. What is a tripod position? Can you see this? Can you see this image? Are you still with me, guys? Is the speed okay? Let me know if you find the speed. Are you okay with the speed? Is it fine? Do you want to increase my speed? कुछ बोलना है आपको? Okay. ठीक है, ठीक है, ठीक है. Okay. So at 6 months, you can see there is a tripod position where the baby takes, yes, okay, the baby starts sitting with support. All right. Then at 8 months, what happens? The baby sits without support and starts crawling. Now, what is crawling? The baby's chest is on the ground, right? What about 10 months? See, the baby starts standing with support and creeping, okay? Now the chest is above the ground. See, very, very important. The chest is above the ground. These images are important, all right? At 15 months, remember, the baby starts walking without support. And this has been asked in the exam many times. Your tricycle has also been asked. Good evening, Bobby. Good evening. So go through these images, very important, and these are your gross motor milestones. Okay? Let's go to the next question. Yeah, we are at the next question. Look at the next question. Okay. So when you look at this question, what is happening here? Can you tell me the diagnosis? See, firstly, remember this patient is having something known as type 1 hypersensitivity. Why type 1 hypersensitivity? Because the person is having an allergic reaction. Right? Yes, very good. An allergic reaction. Okay, very good, very good. And which cells are involved in this? Which cells? Definitely, if you remember from your allergic reactions, from your hypersensitivities, it was the mast cell. What was the mast cell doing? It was degranulating, right? And it released what? Histamine. Very good, guys, histamine, right? Macrophages, if you remember, it is the most important cell in your chronic inflammation. And fibroblasts, if you remember, they are involved in healing. Plasma cell, all the antibody comes from plasma cell. You remember that, right? What is this stain? Can anybody tell me what is this stain? Yes, very good. This is your toluidine blue. Okay, this is your toluidine blue. All right, where and toluidine blue is used to stain basophils as well as mast cells, right? And they appear purple. Okay, they appear purple. Remember, the stains are very important for the exam, guys. Go through the stain. Pearl's Persian blue is used for iron, right? It is used for hemosiderin and iron. And it will not look like this. I promise you, it won't look like this. Okay, this is your toluidine blue. Remember that. Okay. Also, if you remember your macrophages, very, very important chronic inflammation. this question was asked, right? Konsa, this was your previous year question. So microglial, they're seen in brain. This is seen in lungs. What about this? Liver. Do you remember these? Yes, very good. You remember? These are very, very important. They have been asked in the exam. Okay? Yeah, okay. Can anybody now answer this? See, without looking at the question, can you look at the image and look at the signs and tell me what is the answer? Yes, very good, guys. Very good. Yeah, this is your. So, what is this patient coming with? Severe headache, fever, and neck stiffness. What is the diagnosis? Can anybody tell me the diagnosis here? Can anybody tell me the diagnosis here? Diagnosis, guys? Yes, this is an acute case of meningitis, right? Meningitis, and most likely bacterial meningitis, because bacterial is the one which is acute. Okay? Yes, very good, very good. So, what sign do we see here? When you extend, see guys, whichever institute you belong to, whichever, I am a teacher and I love you all, okay? It doesn't matter which institute you come from. I know that I love this and I love you, and nothing else matters to me, okay? So, I am there for you, whichever institute you are from, I am there for you. And if you ever have doubts, I always reply. You would have seen that, okay? Is it stuck? Is it stuck? Okay, is it stuck, guys? Are you okay? Okay, so this is your Kernick sign. What is Brudisky? Yes, yes. What is Brudisky? You pull the neck up and the hip and knees will be flexed by the person, right? What about Oppenheimer reflex? This is seen in upper motor neuron lesions, okay? Where you stroke ऐसे नीड पे मतलब anterolateral anteromedial aspect पे if you stroke on the tibia, the patient will show you a Babinski sky, okay? विक्स या वो है क्या? विक्स या कॉफ? नहीं, विक्स या गर्म पानी? Okay, okay. I'm having a cough. I'm so sorry. Okay, now look at this question. Yeah, there's a little bit lag. Okay, so I don't know what happened today. My halat is very bad. Okay, so usually I'm more active, but today I'm not able to. So yeah, thank you so much. बहुत सारा ढेर सारा प्यार है आपके साथ मैम, हमेशा रहेगी. You know that, right? So which one is this? See, look, this patient denies any, so comes with intense itching, redness, exposure to spring, summer, bilateral conjunctivitis, hyperemia, presence of ropey mescoid discharge. Okay, ropey discharge, you remember which one is this? This is your spring catarrh, right? This is your spring catarrh. Very good, very good. Okay, so trachoma, if you remember, trachoma is caused by chlamydia trachomatis. It is a chronic inflammatory conjunctivitis, right? And what is the strategy for that? There is something. Treatment is through safe strategy. You remember that, right? And what is a safe strategy? You're going to do surgery. You're going to take antibiotics, facial hygiene, and make sure the environment is improved, right? What do you see? Whenever there is inflammation, follicles will appear, right? What is the appearance of the follicle here? It is sago grain follicles, right? Sago grain follicles. Okay, it is seen in the upper palpebral conjunctiva. Okay. What about this? When healing happens, it heals through arch line, right? It heals through arch line. Can you see this line here? So it's a line of cicatrization present between the lower two-third, okay, lower two-third and upper one-third, right? Upper one-third. Okay. What about this? This is the most pathognomic site at the limbus. Can you see these depressions, these black depressions? They are known as your Herbert pits. Okay, they are known as your Herbert pits. Okay. What about this? Cornea. Can anybody tell me, is it vascularized? Normally, it is avascularized, right? But what happens here? You can see corneal vascularization superiorly. This is known as Panis formation, right? So this happens in trachoma. All the images of trachoma are here. See, sago grain appear in it's your arch line, your Herbert pits, and Panis formation. What about vernal conjunctivitis? Yes, spring catarrh. Definitely, so many of you have been telling it is the cobblestone appearance. So remember, the follicles appear more than 1 mm. Okay, more than 1 mm. And here, these are your white debris, collection of eosinophils and debris on the epithelial, on the limbus, right? These are known as Horner contrast dots, right? So remember, this is allergic keratoconjunctivitis. Allergic keratoconjunctivitis, it is IgE mediated. Okay, remember, it is associated with ropey discharge. Okay, it is associated with ropey discharge. Very, very, very important. All right. Good evening. Thank you so much. Thank you so much. Giant papillary, the same thing, but it is mechanically induced. Like there will be some lens. They'll talk about lens and flectin-nular conjunctivitis. Remember, it is a type 4 hypersensitivity. It is most commonly seen in TB. डिफरेंशिएट कैसा करते हैं दोनों को? देखो, ये ब्लैक हर्बिट पिट्स आर ब्लैक एंड दीज आर वाइट. Okay, these are white, your Horner. These are seen in spring catarrh. All right. What about sago grain? See, these grains are so small. Okay, they are less than 1 mm. What about your cobblestone appearance? It is bigger. All right, it is bigger, more than 1 mm. Okay, let's go to the next question now. Okay, also you see flectin is a nodule. Okay, you see a nodule near the limbus. All right, and your bacterial conjunctivitis, it will present with mucopurulent discharge, right? Mucopurulent discharge. Now look at this. Can anybody read the question? A 20-year-old college student presents to the GI clinic with complaints of unexplained fatigue, tremors, difficulty with handwriting. On examination, subtle tremor of the hands is there. Okay, there's a low ceruloplasmin level and golden brown discoloration on the Descemet's membrane. Okay, very, very important. This was your previous year question. So if you can see, even in the question, I've put the important points. Okay, make sure you go through the question because all the clinical features are there in the question. All right, and if you see this, what happened? What is this? This golden brown ring that you see. Okay, in which membrane? Again, remember, it is your Descemet's membrane, right? This golden brown ring is known as the KF ring. Okay, and this is seen in Wilson's disease. If you remember about Wilson's disease is a gene defect in ATP7B, right? And because of that, there is an increase in copper, right? There is an increase. Yeah, copper is everywhere. Copper is everywhere, right? So you also see a cataract here. Which cataract is this, guys? If you see, this is your sunflower cataract. Yes, yes, very good. This is your sunflower cataract. And KF ring, deposits of copper in Descemet's membrane. Also, you see basal ganglia, there are hyper intensities, and you see this appearance. What is this appearance? this is your panda sign, right? This is your panda sign. They're all seen in, where are they seen? In Wilson's disease. Very good. What about ATP7A? Can anybody tell me? Here the copper levels decrease. Okay. So on chromosome 13, ATP7A, what happens? Yes, this is your Menkes. Also remember, this is also known as kinky hair disease. Okay, kinky hair disease. Very good. And you can see the hair, brittle, kinky hair here. Yes, very good. Who said that? Yeah, very good, guys. Now look, this is a table. You can go through this. This is your lysosomal storage diseases, right? And very important, Niemann-Pick, Gaucher's. Gaucher's has been asked so many times. Remember, it is a defect in glucocerebrosidase. Fabry is galactocerebrosidase. Fabry's is alpha galactosidase. Okay, so make sure, yes, panda sign on Galium scan, definitely it is your sarcoidosis. We were going to discuss, hello Pranav, hello, yeah. So anyways, you see this sign, can anybody tell me what is this sign? Kuch Vicks ya kuch? Yes, on Tay-Sachs. Tay-Sachs, firstly, what is the defect? It is hexoaminidase. Okay, hexoaminidase. ठीक है, तो बोलने में थोड़ा इशू हो रहा है. आई एम सो सॉरी. मुझे अचानक इट जस्ट हैपेंड टुडे इटसेल्फ दैट आई एम नॉट एबल टू स्पीक प्रॉपर्ली. लाइक देयर इज समथिंग लाइक पुलिंग और समथिंग लाइक दैट. ठीक है, तो आई एम रियली सॉरी. आई एम यूजुअली वेरी मोर excited, but it's like this. Yeah, so here you can see the cherry red spot. Firstly, cherry red spot, where is it seen? अच्छा लगता है ना अगर स्मूथ चलता है कुछ, पर अगर रुक के चला तो फिर yeah, cherry red spot, it is seen in CRAO. Also remember, it is also seen in Niemann-Pick and Tay-Sachs disease. Okay, both. And can you see this on electron microscopy? Can you see? अच्छा, थोड़ा yeah, I feel better now. Yeah, my voice, it was so hard to talk for so long. I was pushing myself. Okay, so this is your onion skin appearance. Okay, this is your onion skin appearance on electron microscopy. It's so smooth. तो मुझे एक और glass दे दो. Thank you so much. Love you. Yeah. So onion skin appearance, and it is seen on electron microscopy. Can you see this onion skin appearance? Right. Very good. Very good. So this is your onion skin appearance. Yeah, very good. And onion skin appearance, if you remember, it is also seen very good. It is seen in Ewing's sarcoma. It is also seen in so many other places. Which other places? See, your ma'am has done a table for you. So here you can see that it is seen in malignant hypertension. Okay, malignant hypertension, you have this onion appearance. Okay. Yes, very good. And biopsy of primary sclerosing cholangitis. It is also seen in Ewing's sarcoma. Can you tell me, Ewing's sarcoma, is it radiosensitive or radio resistant? Do you remember? This is the most radiosensitive tumor. Okay, most radiosensitive tumor, right? Very important. Most radiosensitive tumor. All right. And it is seen here also. Now, when you look at the brain biopsy, what happens? There is balloon degeneration of the neurons, right? Of the neurons. Niemann-Pick, you see on electron microscopy, you see zebra bodies, right? Can you see these zebra bodies? These are your onion skin appearance on Tay-Sachs, and this is your zebra bodies on Niemann-Pick, okay? And Gaucher's disease, does everybody know? Okay, Pritam, just let me go on. I'll take a little bit faster now. Actually, I had a problem talking, but now it's better. Can you see this crumbled tissue paper appearance? Can you see this crumbled tissue paper appearance? Yes, very good, very good. So crumbled tissue paper appearance with hepatosplenomegaly and Elder-Mayer deformity. This is seen in Gaucher's disease, okay? And remember, this is the most common lysosomal storage disorder, right? Lysosomal storage disorder. Let's go on now. Let's answer this question. So again, look at all the images, very, very important. Your cherry red spot, it is seen in Tay-Sachs and Niemann's. Onion skin appearance, zebra in Niemann-Pick, and then balloon degeneration in your Tay-Sachs, right? And crumbled tissue paper appearance in Gaucher's. Very, very, very important. Let's go to the next question. So I'll be a little bit faster. Now, when you look at this image, can you see that there is again a target sign that you can appear, target sign, or it is also known as bull's eye maculopathy. Bull's eye maculopathy. Okay. Now this is caused due to what? Can anybody tell me what is this caused to? Yes, very good. It is caused due to chloroquine. Okay. It is caused due to chloroquine. So with this question, I think we can cover a little bit of malaria and target signs as well. So bullseye maculopathy, it is also seen with amiodarone. Can you tell me one more side effect of amiodarone? Anybody? Yes, yes. Bullseye is also seen in erythema. Can anybody tell me what is another defect of one more side effect of amiodarone? Very, very, very famous question. Can anybody tell me? Yes, very good. It causes pulmonary lung fibrosis. Okay, pulmonary lung fibrosis. Oh, I feel so happy. I can speak normally again. Yeah, and Blue syndrome. Very good. Pulmonary fibrosis and Blue syndrome. Very good, very good. Okay, very, very, very important. Yeah. Okay, okay, yeah. So now I feel like Sara again. Okay, so जो शुरू में मेरे साथ रुके, I love you guys. I could not talk, but you still stood with me. Remember, for malaria, the drugs are very, very, very important, and this will definitely come in your exam. So ACT for falciparum, whenever in India, which is the most common? Can anybody tell me? In India, which is the most common? So if you remember, in India, it is falciparum. And for malaria and falciparum, what is the drug of choice? It is ACT, right? And ACT is given on the basis of northeastern and the rest of India. So rest of India, we give ACT plus SP, right? Northeastern, we give lumefantrine. We add lumefantrine. Very, very important. In the clinical question, they will always tell you about this, that the patient presented from Assam. So if the patient was from Assam, what would you do? You would give artemether and lumefantrine, right? Yes, very good, very good. And what about quinine? Quinine is used in resistant malaria. What about the drug of choice for Vivax and Ovale? Remember, it is chloroquine. Okay. Also, the drug of choice in Ovale and Vivax, like if there was malaria in pregnancy due to Vivax and Ovale, it is also the drug of choice for in pregnancy, right? It is also the drug of choice in pregnancy. For complicated malaria, and this question has been asked 2 times in your exam, okay? Complicated malaria, falciparum, you give IV artesunate. Okay, for complicated, you give IV artesunate. Okay, yeah, primaquine is contraindicated in pregnancy. What about this one? Now, remember in your first trimester of falciparum, you give quinine, and second and third you give ACT. If it is falciparum, Plasmodium falciparum causing the malaria in the first trimester. Okay, you give quinine and second and third ACT. Remember, these are very, very, very important topics. Also, target sign. Where else do you see target signs? You see it in CSF rhinorrhea, right? You also see it in erythema multiforme due to drug and Lyme disease, but only a single one, intussusception on USG. Okay, you see a donut sign, remember? And bullseye maculopathy. due to chloroquine. All right. Is the speed okay now? Look at this. This is your donut sign, right? Can you see? This is your donut sign. Also, if you remember, anybody tell me what X-ray do we see on intussusception? Yes, very good. Beta 2 microglobulin in multiple myeloma, beta 2 transferrin in CSF rhinorrhea. Okay, beta 2 transferrin. Very, very, very important. Okay, again, previous year question. Yes, and you also can appreciate the presence of claw hand on X-ray, right? Claw hand. Yeah, claw sign, claw hand. This is multiple, right? So this is your erythema multiforme. All right. And everybody saw this. This is the sniff test, okay? Sniff test, CSF rhinorrhea. Sniff test, what happens in CSF rhinorrhea? When you sniff, does it go back? No, right? And you put, yes, very good. So this is your target sign. Yeah, target, halo, whatever. So many signs are there, right? And this is seen in Lyme's disease. Just one target. All right? Chalo, very good. Let's go to the next. Banana sign. So why have I put banana here? Do you remember the gametocyte of your falciparum? Gametocyte of your falciparum. Do you remember? Ah, I feel so happy. Yeah, okay. Okay, do you remember your gametocyte of falciparum? Yes, very good. Okay, yeah, falciparum. Yes, banana on ultrasound is seen in spina bifida, right? It is seen in spina bifida. Banana sign is seen in hypertrophic obstructive cardiomyopathy and the gamete of falciparum. Also in SDH, right? So you can see this is your banana shaped gametocyte. Okay, banana shaped gametocyte. What about this one? Yeah, schizons with the headphone appearance is also seen in falciparum. Okay, so here you have two signs in spina bifida, right? One is the lemon sign. This is your lemon sign, and inside the cerebellum makes the banana sign. Okay, this is your banana sign. All right? Yes, very good. Okay? Yes, in the fetus. What about this? Can you see there is such a big left ventricular hypertrophy? Okay? And this actually ये खुला हुआ बनाना जैसे ऐसे खोलते हैं ना बनाना आपको दिख रहा है आर यू एबल टू सी दिस इज योर बनाना साइन ओके दिस इज योर बनाना साइन आर यू एबल टू अप्रिशिएट द बनाना क्या करते हो बनाना के साथ बस खाते हो या अप्रिशिएट भी करते हो अप्रिशिएट भी करना चाहिए ठीक है तो व्हाट इज दिस नाउ व्हाट अबाउट दिस वन व्हाट अबाउट दिस वन दिस इज योर क्रिसेंट्रिक और yeah Arnold Chiari malformation yes very good SDH okay this is your SDH due to bridging veins right due to bridging veins very good guys very good yes chalo let's go to the next question now very important question you identify what it is nice let's go to the next question so what do you see here see, a tall stature, long limbs, slender. The patient presented with a prominent jaw, high arch palate, signs of joint laxity, and you can see the lens dislocation, right? And can you see it is on the nasal side? Yes, very good, on the nasal side. So, what is the most likely error of metabolism? Yes, very good. This is your homocystinuria. Okay, this is your homocystinuria, right? So, if the levels are normal, then you can choose Marfan syndrome. But Marfan syndrome, remember, ectopia lentis occurs on the upward and temporal side. Okay, let me show you. Can you see ectopia lentis here? It occurs on the temporal and superior side, right? Temporal and upward, yeah, superior side. Superotemporal. Yes, very good. This is a previous year question. Remember to go through this. All right. What about Marfan? Marfan is a defect in fibrillin 1 gene mutation, right? It is a fibrillin 1 mutation. And you also see spider-like hands known as arachnodactyly. Most common Heart defect is your mitral valve prolapse. Most common cause of death is aortic dissection. This question has been asked. Okay, most common cause of death is your aortic dissection. Right? Yes, very good. Yeah. Aditi, I'll bring up the question later. Okay, that is a D-shaped pupil. Okay, iridodialysis is a D-shaped pupil. All right. Let's go to what would be the treatment here? You will give B6, B9, B12. Very, very important to remember. This was an accept question that was asked in your exam. See, the deficiency of B6, B9, B12, all of them can cause homocystinuria. Okay, very, very important to remember. So definitely you will supplement with all three. Okay. Chalo, homocystinuria presents with the deficiency of all three. See, vegan, when we talk about vegan, that's vitamin B12, right? Yes, neurological symptoms, vitamin B12. Now look at this question. What is this question now? Yeah, tell me about this question. तो पता नहीं क्या क्या करते हैं लोग कि उनको ऐसे ऐसे चीजें हो जाती है. Yeah, so this is a herpes simplex 1, right? Herpes simplex 1. It is a cold sore that happens due to herpes simplex 1, HSV1, right? So let's talk about herpes simplex. Remember, firstly, HSV1 does, it has all these vessels on the vesicular lesions on the labial, orolabial place. And what about your HSV2? It is known to cause genital ulcers, right? Genital, painful vesicular genital ulcers. Remember, very, very, very important. Yes, I am feeling motivated by myself. Like I can speak normally again. When I started this class, I saw some of the comments and I like, "Ma'am, mein josh nahi hai aaj," and all that. So but I was trying so hard to talk and I couldn't talk, and I was like, my God. But now I'm very happy. Yeah, I love you too. Don't worry. Okay. So this is your multinucleated giant cell, which is also known as Zank cell, that you can see on the smear. Okay. And this is also your previous year question. So very, very, very important. So your multinucleated giant cell, remember it's a Zank cell. Painful vesicular lesions in genital. Remember it is HSV2. HSV1 on the lips. Yes. Yes, yes, yes. That is a genital. Yeah, very good, Bhavuna. Okay. So now look at this. This is your herpetic vitiligo. Again, this was also your previous year question. So just go through all these images. Very, very important. Now, when you look at this Cowdry type A inclusions, can you see they are intranuclear inclusions? Okay, very important. Again, they give you except or they ask you directly one liner. Cowdry type A, they are seen in herpes simplex. What about B? They are seen in adenovirus and poliovirus. Okay, adenovirus and poliovirus. What about this one? This, everybody knows this famous cell here, which has both intranuclear and intracytoplasmic inclusions, right? Both intranuclear and intracytoplasmic inclusions, right? Which one is this? This is your Warthin Winkle D giant cell seen in measles. Can you remember anything else about measles? You remember it has a triad of cough, coryza, and conjunctivitis, right? Also, you see Koplik spots on the which molar? ऊपर या नीचे? क्या पसंद है? ऊपर या नीचे? Koplik spots. They are. It was asked in your exams. Okay, नीचे क्या है? On the second lower molar. Okay, second lower molar. When do you give it for the first time? When is the vaccine that you give for the first time? When do you give the vaccine for the first time? कपड़े तो पहन लिए पर प्रोफेसर कुछ नहीं yeah yeah okay yeah, we give it at the 9 month. Very good. What do you give at birth? Anybody, can you tell me what do you give at birth? What do you give at birth? You give something known as Bob. This is your previous year question. What is Bob? Hep B, OPV, and yes, very good. BCG. All right, BCG. What about this one? You see these pearly umbilicated papules. What is this? Pearly umbilicated papules. They are seen in molluscum contagiosum. Okay, very, very, very important. Has been asked in your exam very many times. The same image had come. And what bodies do you see here? What bodies do you see here? What bodies do you see here? You see Henderson-Peterson bodies. Okay, Henderson-Peterson bodies, and this is caused by definitely pox virus. What about this one? Very famous bodies, very famous image has come in your exam so many times. So these are your intracytoplasmic bodies, which are your Negri bodies seen in rabies. Okay, it is seen in rabies, right? Thank you, thank you, thank you. I'm so happy you have. Like, I'm like a cyclone, okay? What I do is I either destroy myself or I destroy things around myself. Okay, yeah. What is this appearance now? This vesicles, small vesicles, can you see? Pleomorphic vesicles. Okay, what are these? These are your dewdrop on rose petal appearance that is seen in chickenpox. Are you okay with the speed now? See, I'm discussing images, and remember they are pleomorphic, dewdrops on rose petals. Okay, so we discuss all these images, very, very important. Some bodies that you need to remember will come in your exam. Cowdry type A, B, Wardenfickel D, Negri bodies, your Peterson, Henderson, and what do you say? Multinucleated giant cell, Zank cell. We spoke about herpes, right? Yes, very good, very good. Now let's look at two syndromes because of herpes, because of your HZV, right? What is this? This is your herpes zoster ophthalmicus. Okay. And what they asked in your exam were the ganglions that were involved. So what ganglion is involved? The ophthalmic branch of trigeminal nerve is involved here. Okay. Very, very, very important. Okay. It presents unilaterally. What about this one? Can you see this palsy here? Which palsy am I talking about? Bell's palsy, right? So this comes with Ramsay-Hunt syndrome, also known as oticus, herpes zoster oticus, which ganglia is involved, geniculate ganglia of the facial nerve. This is your previous year question. Okay, even the image had come in the exam. All right, even the image had come in the exam. Is the speed okay? Yes. And herpes, if it reactivates, right? Thank you, Paras. Thank you. It reactivates. It presents as shingles along a dermatome, right? Along a dermatome. All right. Okay. Let's go to the next question now. Very simple question. Look at this image and answer. I don't think you need the question for this. This image is enough, right? Yeah. Yeah, very good, very good. So yes, this is your trichophyton. Why? What is the shape of your trichophyton? It is pencil shaped, yeah, cylindrical, right? Can you tell me where else do we see pencil shaped cells? Pencil shaped cells. Do you remember? Very, very, very important. Black coffee, black coffee. Okay, pencil shaped cells. Do you remember? Yeah, 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 yeah. Very, very important. Anemia. It is seen in your iron deficiency anemia. It is seen in your iron deficiency anemia. If you remember about your iron deficiency anemia, it is microcytic, right? सीता सीता याद है? सीता याद है आपको? Yeah. Thank you so much. Thank you so much. So yeah. Also, you see those pencil and cup appearance in psoriatic arthritis. You remember that psoriatic arthritis? Oh, I am a big addict of coffee. So I love black coffee. I like everything black. Okay, yeah. So trichophyton, it it presents with all three, right? Okay. What about this one? What about this one? You guys, what about this one? What about this one? This is epidermophyton. Remember, it is club shaped, pear shaped. And what about the microconidia? There is absence of microconidia. Important, important. Okay, and it is only seen in skin and nails. It is only seen in skin and nails. What about your spindle shape? Microsporum. Okay, microsporum is spindle shaped, right? It is spindle shaped. All right, it is spindle shaped, remember, and it is present in skin and hair. Okay, skin and hair. Now look at these images. What about this? This is your gray patch, yeah, black dot. Remember, this is tinea capitis. What is this? Can you guys forget black and think of the images here? Okay, so black dot. PYQ topics हमेशा repeat होते हैं ना. Ask any teacher, ask anybody in this world. PYQ topics repeat होते हैं, and we are doing previous year topics more than previous year questions, right? Can you see? I have taken all the 4 options. उसको ऐसे खोल के रख दिया आपके सामने. तो अब ऐसे आप ले लो उसको, ठीक है? Okay, so yeah. What is this? This is your black dog. It is non-inflammatory. What about this? This is where the inflammation is. Okay, it is a chirion. Okay, boggy swelling. This is seen in, yeah, very good, tinea capitis. What about this? Tinea crudis. There are so many types of tinea, right? So this is also known as jock itch. What about this? On the nail, on the nail, on the nail, it is known as angium, and this is your onychomycosis, right? Onychomycosis. Very good. Onychomycosis. What about this one? This is tinea pedis, yeah, athlete's foot, and tinea corporis on the trunk. Okay. Okay, very good, very good. Let's go to the next question. So, very simple question here. Okay, 26-year-old sexually active female presents with shallow ulcers on examination, multiple. What is the probable diagnosis? When you look at this cell, can I see that it is a multinucleated giant cell? Okay, remember what has the patient said? It is painful, shallow on the genital. Yeah, very good. This is your Zank cell and it is HSV. Okay, we have discussed about all the options already. Dutcher bodies, you remember Langerhans cells. We haven't discussed about Langerhans histiocytosis. So remember, it is eosinophilic. It presents with an eosinophilic granuloma. Very, very important. And the markers, these has been asked in your pathology. So please go through this. Langerhans cell histiocytosis, S100, CD1A and CD27, which is the most specific. Okay, most specific. All right. Now look at this. This is your eosinophilic granuloma. This is an osteolytic lesion only on the temporal, mostly on the temporal side. If they want to give you an osteolytic lesion, they'll give you in the temporal region. What about this? This is your previous year question. Which cell is this? Tennis racket appearance. Very good. I am going in a good speed. I think I am going in a good speed. Guys, please tell me if you feel it is, you want me to just, ये है, बोले तो I'll do that. Okay? Tennis racket appearance. All right, this is your which cell? This is your Langerhans cell. And Langerhans histiocytosis will show Langerhans cells, right? They are nothing but antigen presenting cells. Okay? Langerhans giant cells. Now, if you remember Langerhans giant cells, they are seen in TB. Okay? They are seen in TB. Okay, your Langerhans giant cells, they are seen in TB, right? They are seen in TB. Very, very, very important. So there's a multinucleated giant cell and TB shows caseous necrosis, if you remember that. Caseous more than non-caseating, right? Both are seen, but caseous is shown more, right? Now look at this. Look at this. So we started our class with all the kind of infections because I want you to stay safe. I care so much about you that I want you to be very safe. Okay? Especially people in Gautam Nagar, please be very safe. Okay? Yeah. Now look at this. Do I need to look at anything here? This is cauliflower-like. If you remember HPV, HPV का क्या है? 611 causes warts, 18 and 16 causes cervical cancer, right? Cervical cancer, very, very important. So this is your Human papilloma 6. Okay. And what do we do in what do we do in this? What do we do in this? We do something known as pap smear, right? You remember pap smear? And what do we use in pap smear? Can anybody tell me the speculum that we use? Very important. Very, very important. Speculum that we use. What speculum do we use? Yes, we use the speculum. कौन सा नाम क्या है speculum का? ये spatula है ना? What is the speculum? खोलते कैसे है? Sims. This is a new one. This is used for liquid cytology. Okay. Yes, very good. You use the Cusco speculum. ठीक है? Yeah. Those who are in Saket are very, very decent people. Very nice people. Okay. Hopefully, I'll be there soon. Yeah. So this is your IR spatula. IR spatula. Okay. IR spatula. Thank you so much. Thank you, Kabir. Thank you so much. Remember, HPV has two proteins. Your E6 inhibits P53, very important, and E7 inhibits RB gene, which is your governor of the genome, right? Very, very important. Cervical cancer, what is caused by cervical cancer is caused by HPV 16 and 18. What about your most common cause of cervical cancer? It is 16, but more specific is 18. All these one-liners have been asked, right? And vaccines, your quadrivalent vaccine is Cervarvac. It inhibits all, while Gardasil 9, you have Gardasil, which is also quadrivalent, and Gardasil 9 inhibits all these. This was a previous year question, very important. The subtypes, okay? Also, you see these cells which are known as coilocytosis. Okay, coilocytosis. See, the thing is, my side towards you is very maternal. तो आप अपनी माँ से फ्लर्ट करना चाहोगे क्या? Okay, I feel very maternal towards you. So it should turn off, right? Okay. So can you see this perinuclear halo? Can you see that the nucleus has been pushed to the periphery with the perinuclear halo? This is known as coilocytosis. Or is there a lag, audio lag? Is this fine now? Guys, can you hear me? Can you hear me? Yeah, okay, very good. Look at this now. Umbilicated papule. I think everybody can tell this is molluscum umbilicated papule. This is molluscum contagiosum, right? I don't need to explain this. Okay, what about this one? Very, very important. See, before looking at the image, lag बहुत हो रहा है बोल रहे. Yeah, just give me a second. Let me check out. Is there still a lag? Yeah, guys? Yes, okay. So, okay, adjust. आप वैसे भी मतलब FMG हो, आप पूरी लाइफ एडजस्ट कर रहे हो और कर लो, ठीक है? Okay. So yeah, everything is fine. Everything is chill. Look at what surface is this? Is this flexor or extensor? So on the extensor surface, you can see this red flaky flakes with silvery scales, right? This is seen in psoriasis. Very good. Right away, this is your psoriasis. Okay, psoriasis. And what about psoriasis? Remember, lesions are erythematous. You have plaques and papules, and they are usually present on the extensor surface. Okay, they are usually present on the extensor surface. Is the audio not proper? एक बार audio check कर लेना. Is still a lag? अरे audio तो ठीक है. भाई तुम अपना नेट देखो. Everything is fine from my side. ठीक है, रुक. मैम रुक की आवाज देखो. I feel like it is normal. I sound very pretty. No, how can you sound pretty? Lame. Yeah. Okay. So when you do, this is a grattate test. Okay. So when you scrape with a glass slide, what happens? There will be pinpoint bleeding. This is known as a sign known as Auspitz sign. Okay, Auspitz sign. Yes, right. What about this one? Which phenomena is this? Along, if I hurt myself here, along the line of trauma, there will be new lesions appearing. That is known as Koebner's phenomena. A very, very, very important question. It has been asked many, many times. So, Koebner's phenomena, can you tell me the three places? This is an except question. The three places where it has been seen. It has been seen, true Koebner's phenomena. Can you tell me? Yes, it is seen in psoriasis, lichen planus, and vitiligo. Okay, it is seen in psoriasis, lichen planus, and vitiligo. What about your false Koebner's phenomena? Molluscum contagiosum and viral warts. Okay, very good. Now here, can you see? There is pitting of nails. Remember, it is deep and irregular. Okay, deep and irregular. Just remove me from your screen, whoever you are. Remove me from your screen, then come back to me. Okay? Okay? That will just remove that tab, then open it again. It will all be fine. All right? So, deep and irregular. That has been asked. The nail pitting. Okay? It was an accept question. It is deep and irregular. What about this one? Again, this psoriasis will definitely come in your exam. This is that short topic. आएगी पक्का कैसे भी आएगी. Okay? So, this is your subungual hyperkeratosis. Okay? I'll show you subungual hyperkeratosis where there is the nail bed has come up, right? What about this one? Because of that, the nail bed is coming up, right? And here you have this pathognomic sign which has come. मैं बता भी नहीं सकती है कितने बार आया. Okay? This is your oil drop sign. Okay? Oil drop sign. Where do you see oil drop sign? Where else do you see oil drop? There's a cataract also. If you remember, there is a cataract, which is your oil drop cataract seen in. Again, this is your previous year question. Where do you see this? Galactosemia. Very good. Galactosemia. Very good, guys. Very good. Here, galactosemia. Right? Myotonic dystrophy will show you something else, right? Myotonic dystrophy, anybody? What do you see? Which kind? So I've written it down here. You can go through. All right? Very, very important. I've written it down here. What about guttate psoriasis? This was one of your previous year question. So I put it all because ये आपको पता होना ही चाहिए. ठीक है? Christmas tree cataract. Very good. Christmas was just around the corner. That whole thing was circulating everywhere, right? Yes. The patient will present with a history of pharyngitis and raindrop-like lesions are seen. Okay? This was your previous year question. Pustular, remember, it usually happens when there is a sudden stop of steroids. Okay? Sudden stop of steroids leads to pustular. And in pregnancy, it is known as dermatitis. It is known as impetigo herpetiformis. If you remember, can anybody tell me what extraintestinally manifests as dermatitis herpetiformis? Anybody? Anybody? Yes, it is a misnomer. Okay? मैं कॉफी डाली बहुत कम डाली मैं बहुत ज्यादा पीती हूँ हाँ थोड़ा कॉफी और ऐसे भर के हाँ या celiac disease, right? Okay, celiac disease. Psoriatic arthritis, I just told you pencil and cup. Okay, remember it is seronegative. See, all these are very, very important questions. It is seronegative, okay, and involvement of DIP is seen, okay? Involvement of DIP is seen. Also, you see something known as Munro's microabscess, which is a neutrophilic abscess. Okay, you can see neutrophils in this microabscess, all right? Yes, we will talk about celiac disease, all right? Also, you see this spongiform pustule of Koyoj. Okay? Pityriasis, can anybody tell me what is pityriasis caused due to? Kevat is seen in, can anybody tell me kevat, where do you see kevat? Lichen planus, okay? Yes, Malaysia furfur, but Malaysia globosa more than furfur. Remember this. If they give you both the options, you have to choose one. Choose globosa. Okay, and this is your Malaysia. Yes, and even this has been a previous year question, so I couldn't miss this, right? Yeah, and what do you see? You see these hypopigmented lesions. Okay, hypopigmented lesions. Yes, and on KOH mount, 10% KOH mount, you can see the spaghetti and meatball appearance. दिख रहा है spaghetti और meatball जैसा, पर तुम्हें याद करना पड़ेगा, ठीक है? Yeah. Scleroderma, what is scleroderma? It is thickening and induration of skin. If systemic features are involved, it is known as systemic sclerosis. Remember, this is ANA positive, very, very important. Raynaud's phenomena is seen. See, guys, trying to integrate as much as possible. Look at this. What is this phenomena known as? Raynaud's phenomena, and it is transient vasoconstriction, right? Due to episodic vasoconstriction in response to cold or stress. Okay, primary without any connective tissue disorder is known as primary. Again, this was asked in my exam as well. Okay, all right. So first it is white because of the vasoconstriction, then cyanosis happens, so it becomes blue, and then uh, vasodilation happens, so it becomes red. Okay, so it is white, blue and red. Even that was asked in your exam. See, कैसे तोजू type of questions पूछे जाते हैं, right? Limited systemic sclerosis, it comes with this, and remember the antibody involved in that. Okay, remember the antibody involved in that. Yes, this PDF will be available. Okay, very, very, very important. And diffuse systemic, definitely it is anti-topo isomerase antibody. Again, very high yield. You have to go through this. And what is sclerodactyly? It is just this, because of the thickening of the skin has become very tight, right? And because of that, it has become all shiny, shiny, shiny. So this image has come, these bodies have come, this syndrome has come. Make sure you go through it. And this table को ऐसे last minute, it's very, very important. 100% short table. Okay, go through this, very, very high yield. Anti-nuclear antibody, it is seen in SLE, but non-specific है. हाँ, रट लो क्या, रट लो आप लोग, इसको रट लो, मतलब ऐसा, मतलब when I do this is for my brain. Okay, चला जा अंदर, चला जा. Okay, it's like that. Okay, yes, मार लो, मतलब रट्टा मार लो. Okay, right, SLE, more specific. See, these are specific to SLE. Antihistone are for drug-induced lupus. Can you tell me the drugs that are important? Orenburg was amazing. I had such a great time in Orenburg. Okay? Yeah. Ship drugs. Okay? Ship D drugs. Yes, very good. Shipped drugs. Yeah, shipped drugs. Very, very important. It is sulfonamide, hydralazine, isoniazide, and prokinamide. Right. Very good, very good. So these drugs, this patient was on this drug, and suddenly this happened. So that, and then they'll give you this antibody. Remember. What about anti-ro? Jogren. Jogren, you remember? It is dry eyes, dry mouth. जैसा मेरा मुंह हो गया था ना, पूरा सूखा सूखा. But then I got coffee. Okay, dry eyes. All right. So CREST syndrome, anti-syndromeric. Remember, this is limited. Okay, and Cherstow, ये सब आता है exam में. So very, very important. Your vaginous, it comes with a triad, you remember? Blue eyes are seen in osteogenesis imperfecta, blue sclera, right? Okay. Urticaria, chronic form of urticaria. ठीक है? Chronic form of urticaria, what do you see? You see dermographism. क्या समझ रहे हो तुम लोग यार? मैं इतने अच्छे से पढ़ा रही हूँ, तुम लोग ऐसे. Okay, exaggerated wheel flare response. Okay, it is an exaggerated. So तुम ऐसे टच करोगी तो पूरा ऐसा खड़ा हो जाएगा, right? Skin पूरी ऐसे खड़ी हो जाएगी. Okay, so that is dermographism. Can you see elevation here? Okay, can you see elevation here? Right. Very good, very good. Now let's go to the next question. जल्दी answer करना, बहुत important question है. It will be important in the exam as well. Is there still a lag? Okay. Yes. So what is the answer? Yes, this is your basal cell carcinoma. Okay, it is your basal cell carcinoma. What about cell carcinoma? Remember, it is the most common malignancy of skin. Okay, skin का कैसा है? ECC, then your malignant melanoma. Okay, it is also known as rodent ulcer, and it is locally invasive. Okay, just around like a rat, right? Yeah, never metastasizes, rarely metastasizes, right? Okay, in your squamous cell, you see these pearls. What are these pearls known as? They're keratin pearls, okay? And you see this on, this was asked in your previous year question. So very, very, very important, all right? What about this? Malignant melanoma, you remember your A, B, C, D, E of malignant melanoma? Okay? A, B, C, D, E, there is asymmetry. Can you see? There is asymmetry. Borders are all irregular. The colors are different. Okay, the colors are different and diameter is more than 6 mm. Again, this is your previous year question. Okay, this is your previous year question. Got it? Yeah, very good, very good. What about this one? Rhinophyma, long-standing case of rosacea. It is also known as potato nose. Okay, it is hypertrophy of sebaceous glands. Okay, it is a hypertrophy of sebaceous glands. And the treatment was also asked. All right, yeah, Om Puri ko jo hua tha. What about this? Now, if you see this is only on one side with the dermatome. So this is your vitiligo, which is segmental, right? So now look at the images here. I think I don't need to discuss this. Let's look at the images. Albinism, it is a defect in tyrosinase and it can be seen in Shinya-Higashi syndrome as well. Okay, oculocutaneous. Remember, it is oculocutaneous. What about pybalidism? You can see this, right? What about this? Leukoderma, it happened due to bindi. And these are all hypopigmented. Okay? And you remember, yeah, List gene. Oculocutaneous, it is a defect in List gene. Very good. Okay? List gene. Very good, very good. What about this? Hyperpigmentary. Again, this was also asked in your exam. It is hyperpigmentation on the malar regions. And in pregnancy, melasma is known as closma. Okay, this was asked in your exam. It is known as closma. Okay, what about this one? Yes, this is your congenital melanocytic nevus. This is your Hughes-Jaeger syndrome, mucosal lentigens, right? We have seen mucosal lentigens here. Yeah, you have hamartomatous polyps and the Christmas tree appearance. Very good, very good. Polyps. And what is the gene defect? STK11 gene. Yes, STK11 gene. Now, what about this? If you see, these are your cafe au lait spots, right? Right? And they should be more than 6. They are present in NF. You remember where is NF1 present? On the 17th chromosome, right? Yes, very good. What about this? This is your McQueen-Albright syndrome. You remember McQueen-Albright syndrome? Yeah, McQueen. And can you see that the lesions are only unilateral, right? It is associated with fibrous dysplasia as well, where you see this shepherd-crook deformity, right? Yes, precocious puberty. All right. And this one is your Becker's nevus, where you can see hypertrichosis. Usually it's on the back or trunk. Okay, upper back. Right? Yes, very good. What about this? This is your nevus of Ito. It is congenital. Okay, and it is bluish gray. This one, it involves your trigeminal nerve. It is nevus of Ota. It's on the face. Okay. What about this one? This is your Mongolian spots. Okay, most common region is lumbosacral. Okay? All right? Yes. Now let's look at this. Can anybody tell me what is this? Which of the following may be used to prevent recurrence of the image shown? Can anybody? Yes, this is a pterygium. So what do we do for pterygium? So one pterygium, it is seen on the nail. Where do we see pterygium on the nail? Yes, very good. You do re-accession with autograph, but here we don't have that option, right? So we give mitomycin C. Yes, very good, very good. So pterygium, remember, it is a triangular growth towards the apex of the cornea, and surgical excision with has a high recurrence. So we do autografting with topical mitomycin C. Okay. Yes, very good. It is seen in lichen planus. Very good, very good. What about this one? This is your pigincula, right? Fat-like nodules. This was also asked. It was asked in NEET PG. Okay, it's usually on the nasal part of the conjunctiva. Okay, nasal part of conjunctiva. Let's go to the next question. Now look at this question. When you look at this image itself, can anybody tell me what is this? What is this image? What is this image?
Is
Yes.
there still that?
Yes. Haral patch. Yes, this is the first patch. Okay, Haral patch. And this is your Pityriasis rosea, and it is your Haral patch. Yeah, very good, very good. So remember, it is papillosquamous. You can see this Christmas tree pattern and collarate lesions. Can you see at the end? Yes, very good, guys. Collarate lesions are seen and Christmas tree patterns are seen. The first patch to appear is known as Herald patch. Okay, this is seen in Pityriasis rosea. What about lichen planus? You can see it's all PP in lichen planus. It has papules. It's purple. It's polyclonal. It has plaques, papules, and it's pruritics. It's also associated strongly with dental amalgam. Okay, it is a pre-malignant lesion. You see this. This is your Wickham striae. All right, lacy pattern on the, and usually it happens on the flexor surfaces, right? What about your buccal mucosa? This is your oral lichen planus, and many times in the question they tell you about the oral lacy reticular pattern, right? Can you see this? Can you appreciate the oral lacy reticular pattern? Yes, very good, guys, very good. Yes. Psoriasis on extensor and this thing on, yeah, very good. And you see these signs, which is your pup tent, nail signs, pup tent. Then you see anonychia. What is anonychia? Anonychia, and it is the complete absence of the nail, right? And this is your pterygium. Can you appreciate the pterygium? Yes, very good, very good. Can you appreciate the pterygium? Yeah, no nails at all. So I tell this is a very good sign for girls, right? It's very good. What about this now? Very important. Can you see that these lesions, anybody, can you tell me what is this? Which one is this? TB hai? No, nothing like that. अरे मैं थोड़ा मैंने कुछ बोला ही नहीं. Okay. Yes, this is borderline leprosy. This is borderline leprosy. Okay. Lepromatous leprosy in the later phases will show you lionine feces, right? What about borderline lepromatous leprosy? Let me show you all the images related to this. All right. So in your tuberculoid leprosy, remember there are five types of yeah. So there are five forms of leprosy, right? Five forms. Which one is it? It starts with T, ends with L, right? So TT, BT, BB, BL, and LL, right? From TT to LL. So what happens? The fast bacilli. How to? Okay, acid fast bacilli increases your cell-mediated immunity decreases, skin lesions will definitely increase, and the nerve involvement will increase as well, right? Here, can you see, this is your annular lesion where there is a central clearing and central depression and the ends are elevated. It is also known as saucer right way up appearance. Okay, this is seen in TT, very, very important. This is your satellite lesion where can you see this big lesion and can you see the small lesion here? This is known as your satellite lesion. Okay, and satellite lesion has been asked in your exam. It is a previous year question. Yes. All right. What about this one? These are your geographical map-like lesions. They are seen in borderline. Okay, borderline. And this, whenever they mention almost symmetrical, okay, somewhere they will mention almost symmetrical. Remember, almost symmetrical is BL, all right? And TT is showing you line faces here. LL, I mean, sorry. Lepromatous leprosy. What about this one? Can anybody tell me what is this? This is your National Leprosy Eradication Program. This is the sign that is seen there, lotus pakadkar, right? ठीक है, तो ये पीएसएम का आपको पीएसएम चाहिए था ना, दिस इज योर पीएसएम क्वेश्चन जो सब पूछ रहे हैं. प्लीज रिमेंबर दिस इज अ वेरी वेरी इंपॉर्टेंट क्वेश्चन. यस, लेप्रेसी का. ऑल राइट, पॉसिबेसिलरी, सी इन इंडिया वी फॉलो द NLEP regime, राइट, नेशनल लेप्रेसी इरेडिकेशन प्रोग्राम. तो इसमें क्या है, पॉसिबेसिलरी में वी गिव 2 drugs for 6 months and for multibacillary we give 3 drugs for 12 months. Okay, so remember this, very 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 important. We follow NLEP. अगर WHO पूछो तो if they ask for WHO then this is the thing. Okay, now look at this. Chalo, this is an FMT question. What cuts do you see here? You see something known as, can you see the multiple cuts? Okay, very good, very good. Yeah, right. Line facies LL में दिखता है. Yes. Hesitation cuts, right? Yeah, okay. Moe, are yaar. Okay. So what about this one? Can you see what, if you see, this is a grace, right? And this is the most common grace abrasion. Yeah, grace abrasion, you can see that this is a road rash. What about this? This is a pattern bruise. Yeah, whenever there is suicide, right? Attempt to suicide but doesn't want to suicide, there will be hesitation cuts, right? What about this one? This is a pressure abrasion. I just go through the images, I'll just go fast. All right. So make tables, keep them stuck on the wall and then you can revise. Every day you see a little bit and then you can revise. Nibba nibbi harkat yaar aise mat karo. Okay. So this, can anybody tell me what is this? Yes. What about this? This is your battle sign. And this happens due to, yes, very good. It happens due to middle cranial fossa fractures, right? Anterior cranial fossa fracture will present with raccoon eyes, right? Will present with raccoon eyes. Okay, very good guys, very good. Yes, very good. So on the mastoid region, yes, on the there is ecchymosis on the mastoid region, right? Yes. What about this? This is your raccoon eyes due to anterior cranial fossa fracture. What about this? This is your tramline bruise, okay? Tramline bruise. This one is a laceration, okay? And can you see the rough edges? Can you see the rough edges? Right? Yes, okay. So tissue bridges are there, crushed hair. Can you appreciate the irregular edges? What about an incision? It is well defined, right? It is well defined. And this one is your previous year question. See, whenever there is a blunt trauma, your blunt trauma on any bony prominences, then what will happen? There is an incised looking laceration. Okay, incised looking laceration. We'll be taking this session till 10. जब तक आप बोलो, ठीक है? Incised looking laceration. And if you can see, this is a chop wound. All right? Chop wound. आपको मुझे छोड़ना है क्या? Now look at this question. Look at this question. Do you want to leave me? I do not want to leave you. So you stay here with me. Okay? Is it horseshoe? Is it horseshoe? Look at this. A 50-year-old female presents to the hospital for a routine checkup. She gives you a history of abdominal pain, usually after eating. On physical examination, her sclera and skin has a yellowish discoloration. You order a CT and the image is given below. What would be the most appropriate? Can you see here? Look at the gallbladder. Can you see there is, what gallbladder is this? Yes, this is your porcelain gallbladder, and definitely you have to do cholecystectomy for that, right? Cholecystectomy, right? Look at this. This is your porcelain gallbladder, right? Calcification is seen there. Yes. Yes, the PDF will be provided. Now, when you look at a gallstone, right? This is an ultrasound of the gallstone. What can you see at the behind? There is a post-acoustic shadow, right? ठीक है, very good. What about this? What about this? No shadow is seen. So this is a polyp, right? This is a polyp. And you should remember the indications for your cholecystectomy. Remember, porcelain gallbladder with stones, gallbladder polyp with stones, and multiple stones which are more than 2 centimeters. Also diabetes. If a patient comes to you, you just found out that the patient has multiple stones, but the patient does not have any kind of symptoms. Do you do a cholecystectomy? Do you do a cholecystectomy? Anybody? We will take the session till 10. Okay? Is that fine? All right. Okay. So you won't do. Only when there are conditions like this, you do. या आपको पैसे कमाना है उससे तो करेंगे. Okay, so let's go to patho now. Okay, so 17-year-old, you notice web neck, low hairline at the back, and widely spaced nipples. Participating in sports due to lack of stamina. What is this? Definitely, this is your Turner syndrome, which is 45XO. Firstly, karyotyping is gold standard. Okay, this is a karyotype, right? And what can you see here? You can see a missing of X chromosome, right? There is a missing of X chromosome, right? One more X chromosome is missing. Yes, very good. So what can you see here? See, I want to discuss about Downs as well. So when you look at Down syndrome, you can see, what images can you see? You can see sandal toe appearance. Can you see streaky ovaries? See, this is your Turner syndrome. You can see the nipples are wide spaced. The neck has a low posterior hairline. Okay, low posterior hairline. Then you can see what happens to the extremities. There is edema of the extremities, right? Edematous extremities. What about your Edward and Patau syndrome? So these are features of your Turner syndrome. And the ovaries, remember, this patient will present with primary amenorrhea, right? So streaky ovaries are seen. Streaky ovaries are seen. All right? There is, yes, rocker bottom feet, they are seen in both Edward and Patau syndrome, right? Edward and Patau syndrome. See, these are all common features of of your 18 and trisomy 13. What is trisomy 13? It is. So there was a mnemonic for this, na? 13 साल की लड़की को नहीं पटाते, 18 साल में गर्लफ्रेंड बनाते, और 21 years में शादी करते, something like that. So Down syndrome is the most common cause of mental retardation. And remember, when you look at IQ should be less than 70 for that to happen, right? Also, yeah, yes, very good, very good. So Down syndrome is 21, Edward is 18, and Patau is 30. Okay? And patent ductus arteriosus is the heart defect that is seen in these. Okay? Heart defect. And while in Turner syndrome, if you remember, it is bicuspid aortic valve. Okay? Bicuspid. Right? Bicuspid aortic valve. Now look at this. Which one is this? Can anybody tell me? Which one is this? Which one is this? This is your, yes, 18. Can you see 18 here? Trisomy 18. While this one is your trisomy 13. And finally, this is your trisomy 21, right? Trisomy 21. Okay, very good, very good. What about this one now? Can you see that there is a heel prick done and the blood is taken? This is usually done for inborn errors of metabolism. All right, inborn errors of metabolism. And if you remember your inborn errors of metabolism, tyrosinase causes the defect, the disease, albinism. What about phenylketonuria? Very, very important. The defect is phenylalanine hydroxylase, and you have a mousy odor in the urine. Okay, this is a previous year question. It has come in your exam. So make sure you go through this. What about branch chain alpha keto acid dehydrogenase? Burnt sugar smell is seen in the urine, right? Burnt sugar smell is seen in the urine. Okay, I'm doing the best I can. Yeah, I'm annotating. Right? Anyway, it's written here. Okay? What about alkaptonuria? Can you see the deposition of, yes, very good, homogentisic acid, right, on the cartilage and on long standing? What happens to the urine? It turns cola colored. Do we see cola colored urine anywhere else? Do we see cola colored urine anywhere else? Yes, very good. It is seen in PSGN, right? PSGN. Very good, very good. Yes. Valine, leucine, and isoleucine. Bhuvana. Very good, very good. What about this one? Can you, just by looking at this image, tell me the answer for this? Can you, just by looking at the image, tell me the answer for this? Can you? Yeah, it is liquefactive necrosis, right? Can you see the tissue architecture is lost here? I want you to remember, just go through this table last minute, right? Liquefactive, it is brain, abscesses, tissue architecture is lost. Coagulative, most common, it is the most common type of necrosis. And organs, all of the organs are involved except the brain. Very important, it has been asked. Your fat necrosis is seen in pancreatitis, the peripancreatic fat, and in breast due to trauma. So you can see this wedge-shaped infarct, right? And if you see here, we have lost all the nucleus, okay? So we see a tombstone appearance here, right? The nucleus has been lost. What about this? If you see, this is your caseous necrosis. Keys-like appearance, right? Caseous necrosis. Caseous necrosis, right? Yeah. What about this one? Can you see the fibrin is deposited throughout? This is your fibrinoid necrosis, and the image that I'm showing you is from PAN, okay? Polyarthritis nodosa. Very good, very good. Fibrinoid necrosis. Yes, very good. What about this one? These are your calcium deposits. So I can say this is saponification, right? That is calcium plus fat deposits. Okay? Very good, very good. What about this one? Can you see which gangrene is this? Can you tell me? Is it wet or dry? Wet or dry? So can you see the line of demarcation? Can you appreciate the line of demarcation? This is your dry gangrene. Okay, dry gangrene. Very good, guys. Yes, dry gangrene. Now look at this. There are 4 images, and they've asked you in a patient of Plummer-Wilson syndrome, which of the following is least likely to be observed. So if you can see this image here, I think everybody knows what this is. This is your Zenker's diverticulum. And I would not see this, right? This is seen where? Can anybody tell me? This is an outpouching, which is a false outpouching, right? Okay? Yes, yes, false diverticular. Very good. So you can see what are these? Nothing but you can see this is coelonychia, spoon-shaped nails. Okay? What about this image? It shows you angular chelosis. And glossitis, right? Glossitis. So Plummer-Wilson syndrome, all of this is seen? Yes, yes, yes. And Zenker's diverticulum? Yeah. Plus esophageal webs are seen, right? Esophageal webs are seen, right? And what procedure do you do for this one? You do Dolman's procedure, right? Dolman's procedure is done, right? Yeah, Killian's Dyson's may inferior constrictor muscle. All that is very important. It comes in the exam. Okay? It comes in the exam. Can anybody tell me the answer of this now? So GI polyps were discovered. 2 years he went for a surgery for thyroid cancer, and his family was involved in breast cancer, and aunt was having endometrial cancer. What is this? This is definitely which syndrome? Can anybody tell me what syndrome is this? APC kaise? Look at that. What is the association? You have an aunt with endometrial cancers, breast cancers. This is your Cowden syndrome. Very good. This is your Cowden syndrome. All right? Cowden syndromes. Okay? And it is seen in P10. What about APC? This shows you FAP. This is nephroblastoma, also known as Wilms tumor. And RB gene. सबको पता है RB gene का? See, you remember about your Cowden syndrome? Cowden syndrome will present with multiple hematomatous polyps, trichilillomoma, okay, which is nothing but thickening of the skin, thyroid cancers as well as endometrial cancers. If they show you, if they tell you this, and in fact, won't they tell you about more than 100 polyps or give you a biopsy, right? Yes, very good. What about retinoblastoma? It is the governor of replication. Everybody knows this is the gene defect, 13q14. Okay, 13q14, very important, 13q14. What about this? Nephroblastoma, remember it presents with peripheral calcification. Can you see? And an abdominal mass. Okay, so it can be, what do you say? There can be a differential diagnosis of neuroblastoma, right? But the calcification is inside the tumor here. All right? Yes, it is the most common tumor of kidney, right? Very good, guys, very good. So APC, you know, it is more than 100 polyps, familial adenomatous polyps. It is on the chromosome 5, very important, and you can see more than 100%, and definitely it will lead to colon cancer. There is a 100% risk of colon cancer. All right? What about this? This is seen on leukocoria, right? In retinoblastoma. Also, you see this. What is this? Flexor. Yeah. Can anybody tell me what is this? Yes, your rosettes, right? Flexner, intestine, rosettes. Very good, very good. these are some tumor markers. Please go through them. Very important. Okay. These are some tumor markers. Please go through them. Last minute tumor markers that you have to do. Very important for your exam. It will help you, I promise. Okay. So let's go to the next question. Can somebody tell me the answer for this question? There's blanching purpura, abdominal pain, knee joint arthritis. Urine examination reveals hematuria and proteinuria. What is the most likely diagnosis? Yes, very good. It is your Hinosh-Schollen purpura. Yes, there's a triad of Hinosh-Schollen purpura, right? You'll have palpable purpura. Okay, usually they give you this image only. So it is a kind of IgA vasculitis. IgA vasculitis, right? And palpable purpura is there with abdominal pain and yes, this one presents without thrombocytopenia. Okay, without thrombocytopenia. Very, very important. All right. Medium vessel vasculitis, you can see for your Kawasaki, very, very important. Kawasaki to aata hai, har taraf aata hai. So now when you look at this, yeah, when you look at this, can you see there is conjunctivitis, the mucosal, strawberry tongue, adenopathy, usually unilateral. And what happens on the palms and soles? Okay, mucosal involvement, there is edema of the hands and feet, also a skin rash, erythematous skin rash, right? So cream is important. And how is the fever? Fever will be lasting for more than 5 days, okay? More than 5 days, very important. This, okay, this is very, very important. It comes in the exam. What about this one? Can you see? This is your Burgess disease, right? Burgess disease happens in young males, suttabas, I mean those people who smoke like packs of cigarettes, and they can have this, they can have Raynaud's phenomena, intermittent claudication, rest pain, because it affects all the veins, it affects all vein, artery and nerves, okay? BD boys. BD boys. Okay. Okay, vaginous granulomatous, you know, it is a triad of vasculitis, lungs. What you will hear about cavity lesions in lungs. Okay, cavitary lesions in lungs. So upper URTI and LRTI plus C ANCA positive. Yes, very good. C ANCA positive, and definitely kidney involvement. Okay. Scarlet fever, see, whenever there is a fever of less than 5 days, that is scarlet fever. So look at the days of the fever, okay? Days of the fever. More than 5 days, that is Kawasaki. More than 5 days, it is Kawasaki. All right? What about this one? What about this one? So they have asked you, see, more than the question, the email, this is very important. Can you see that the hepatocyte has bloomed here? What is this? And cytokeratin. Okay. Can you see this eosinophilic cytokeratin? This is a, which body is this? Can anybody tell me? Which body is this? This is your Mallory dung body. Okay, Mallory dung body. Can anybody tell me about Mallory V stare also? Yes, this is your Mallory dung bodies. Where are they seen? Anybody? Mallory dung bodies. Okay. Yes. Mallory V stare. वो दारू ज़्यादा हो जाता है. Yes, binge drinking. Those people who have never seen alcohol, फिर पूरा गटक जाते हैं. Yeah. Okay. Yes. It is seen. So longitudinal tear in the esophagus. No treatment required. It is conservative. Young male की presentation होती है, right? Young male की presentation होती है. Very, very, very important. Okay. What about this one? What about this one? This is your councilman body. Okay, it is an apoptotic body. Can you see? Look at the hepatocytes on the side, and can you see that the cell has shrunk here? Yes. Councilman body, they are seen in acute. Yes, very good, very good. What about this one? Ground glass opacities. Ground glass hepatocytes are seen, right? So remember, and your onion skin fibrosis, it is seen in primary sclerosing cholangitis. We already discussed. All right. So councilman bodies, they are seen in acute hepatitis and yellow fever, right? What about Mallory tank bodies? Mallory tank bodies, they are seen in Wilson's disease, many other diseases. Just remember, I've written down the most important here. What about ground glass hepatocytes? They are seen with chronic hepatitis B. Okay, very, very important. And primary sclerosing cholangitis, onion skin fibrosis is seen. Look at this now. Can somebody diagnose? Just from the starting itself, I think you can tell me. Thank you, Paras. Paras is here. Paras. Yeah, so Paras is a very good friend of mine and a very good. आपसे वो chanting करा है, आप लोग थे उनके session में. Okay? So yes. Okay. Hello, Sri Ram. Yeah, okay. What about this one? Yeah. So this is your celiac disease. What can you see? There's a duodenal biopsy reveals crypt hyperplasia, villi atrophy, and CD8 cells in the lamina propria. So this is a small table. Just go through this. So malabsorption, 3 reasons for malabsorptions, very, very important reasons. Tropical sprue, Whipple's disease, and celiac disease. Remember, when we talk about celiac disease, it is autoimmune, right? HLA-DQ2 and 8 are involved, and these antibodies are involved, which are very, very important. Also, gluten sensitivity, right? So what should be avoided? Barley, wheat, rye, and oat. What about your tropical sprue? Remember, it is infective with GI syndrome symptoms. What about Whipple's disease? Again, this is infective as well, but presents with extraintestinal manifestations. Okay, extraintestinal manifestations. Thank you so much. Afghanistan se aa gaye. Wow, very good. Okay, so yeah, here can you see what happened to the villi? Can you see that there is villus atrophy? Look, this is the normal, and look on this side. Can you see there is villus atrophy? And look at the crypts. Is there hyperplasia? Yes, this is your celiac disease. Okay, what about this one? This is the lamina propria with foamy macrophages with the bacteria in it. Okay, remember it is diastase sensitive or resistant. It is resistant and pass positive. That's why it's so pink, right? Tropical sprue is infective in nature, while celiac disease is autoimmune. Okay, celiac disease is autoimmune. You have autoantibodies, right? These are the antibodies. Okay, very, very important. Just go through this. Now look at this question. So a female came, she gives you a history of dyspnea, chronic cough with sputum, wheezing. She succumbed to respiratory failure despite not being a smoker. Very, very important. So what is the diagnosis here? What is the diagnosis here? Thank you, Paras. Thank you so much. Yeah. So emphysema. And which kind of emphysema we are talking about? We are talking about pan-acinar emphysema, which is the defect in alpha-1 antitrypsin deficiency. Okay. Your most common cause of emphysema is smoking. Okay, and smoking, कहाँ किसमें? पान वाला. Okay, pan वाला, pan. ठीक है, very good. बहुत तुम लोग तो बहुत आगे हो. Yeah, okay. Smoking causes centriacinar emphysema, right? Cystic fibrosis, if you remember, it is a CFTR gene defect. Carter-Jenner syndrome, it has a triad, right? Can anybody tell me what was the triad of Cartagena syndrome? Again, a very famous question keeps getting asked again and again. So can you tell me what is the triad? So it is bronchiectasis, dextrocardia, and sinusitis. Very good. So all three are given here. Please go through the when you're done with this session, I'll give you the I'll send you this PDF. Please save it. Go through this. I've tried to make it as simple as possible and added all the images. So it will help somehow or the other way. Okay. Now this one, in a post-mortem examination of an 80-year-old man with a 2-year history of progressive memory loss, histological findings are given. Can you see which bodies are this? So if you remember, these are nothing but your Alzheimer's. Yeah, very good. They are aggregates of A beta peptide. Okay. So Alzheimer's, if you remember the bodies, what are the bodies seen? पारस सर भी आज पूरा लेक्चर तो पारस सर इज अ वेरी गुड फ्रेंड ऑफ माइन तो देखेंगे ना वो भी ओके या yes you see extracellularly you see amyloid beta plaques right and intracellularly you see neurofibrillary tangles made up of tau proteins right very important yes Hirano bodies yes very good and Down syndrome is there is an increase susceptibility of Down syndrome patients to undergo Alzheimer's, right? Which nucleus is affected? Asked many times. Mayonet is affected. And what levels are decreased? Also, the drug of choice. Can anybody tell me the drug of choice? ताऊजी हीरो बनने की कोशिश या ओके वेरी गुड हीरो बनने की कोशिश आप लोग यस वेरी गुड तो डोनापेजिल रिवास्टिग्मीन and galantamine. Very good. Nice. Yeah. So this table again, go through this table. These are the different types of amyloid. Amyloid doses is a very important, very important this thing. What do you say? Yeah. Saccharin is removed because of hepatotoxicity. Very good. So this table, please go through this. It's very important. Calcitonin, ACAL has been asked. Your A beta 2. Okay, beta 2, A beta 2 has also been asked. So make sure that you go through hemodialysis. This is a previous year question. So go through this last minute. Okay. Now look at this. What is this? Autopsy has been given and can you see this big large vegetations? What are these vegetations? रह जाएगा याद आप याद करते मतलब मेरे साथ चलते रहो साथ साथ याद हो जाएगा ठीक है okay so what about this one this is your infective endocarditis okay infective endocarditis where you see this large friable destructive vegetations and remember they are non-sterile okay non-sterile so I made a table again so go through this table you can see rheumatic heart disease presents with small warty firm and friable along the line of closure very important all of them are sterile except for ओ मेरे साथ तो चलती जा okay yeah infective endocarditis they're large bulky friable destructive and where are they remember they are non sterile okay we have seen the image already they're non sterile what about this one NBTE remember line of closure sterile itna pucha nahi jata but you remember this limb and sac was asked in her exam 3 times okay SLE associated this is SLE associated and they are small to be medium size and they always tell this they are on both the sides of the valve okay both the sides of the valve sterile again the only non-sterile is your bacterial endocarditis right so make sure you go through this table again now tell me the answer for this an 8-year-old boy recently treated for streptococcal sore throat is admitted with fever and polyarthritis. His ESR is elevated at 80 mm per hour, and he has a fever. What is the primary mechanism? So what is the diagnosis? Can anybody tell me the diagnosis of this? So if you can see, ESR is elevated, polyarthralgia. What is this? This is rheumatic. Rheumatic? Yes, this is a type 2 hypersensitivity. Type 2 hypersensitivity. Okay? Rheumatic fever, type 2 hypersensitivity. So if you can see, your rheumatic fever has been given here, type 2 hypersensitivity. Please go through this table. I've note down everything that is important here, right? Type 1 hypersensitivity, do you all remember I think at this point you can all recall the pathogenesis, right? So IgE binds to mast cell in type 1 hypersensitivity, then mast cell degranulizes and histamine is released. Here you have ADCC, very, very important, antibody dependent cellular toxicity. They've asked this, okay, type 2, and the examples also. Okay, so just go through this PDF, go through the table. It's important for the exam. This has to be by hearted. All right. What about your type 3? Type 3, something related to blood vessels. Remember, it is an antigen and antibody complex, and those complex go and deposit everywhere, right? So remember, it has vessels. Somewhere they will be talking about vessels, because first place they deposit is vessels, right? And type 4, it is type 4 contact dermatitis, rheumatoid, Mantoux test. The image base of Mantoux test was given. So go through these mnemonics. All right. Yes, it is delayed. Yes, GG Anshita, that will be done. Now here, I don't think I need to read this question, but just by looking at this, this is such a famous question. Can anybody tell me the answer? Six. Yes, yes. Can you see? This is your orphan Annie I nuclei. Annie. Thank you, Rahil. Thank you. I missed you guys too. Actually, I'm not in my proper condition, but I swear it gives me so much happiness just to be back with you guys, because it's been a very long time and I love online classes. I studied online, so I know the pain that you have to go through to sit at one place and listen and stick with all of us, right? It's very hard. It requires a lot of self discipline to be able to do that. And I remember I was very lonely during that period of time when I had to study alone like that. Okay. So I am very happy that wherever you are very strong. And I'm happy that you're with me and we are able to do this session together. Thank you for joining me in. It matters a lot to me. You have no idea. It means a lot. Okay. A lot has happened in 2023. And now I feel so much better. Okay. Uh, yeah, okay. So orphan Annie I nucleus. Okay, orphan Annie I nucleus. Right? Can you see the glassy nucleus there? Okay, this is seen in papillary thyroid carcinoma. Thank you. Thank you for staying with me. Okay. Thank you for staying with me. Okay. Right? Also, one more appearance that you see in papillary thyroid carcinoma is Samoma bodies. Do you remember Samoma bodies? Thank you, Yashwant. Thank you. Yeah. Samoma bodies, it presents with dystrophic calcification. If you remember that. Thank you for your support, for joining in, for staying with us. You keep us alive, okay? You make us forget everything. And that's what matters. My voice is not good today, but I swear I am very, very happy, okay, to see you all. Yes. Medullary carcinoma, remember, it is a CMIC. You remember about ACAL? We just spoke about ACAL, right? and there is a c-MYC mutation, right? Follicular, they ask about FNAC. Okay? FNAC, FNAC cannot be used to differentiate between follicular, the benign and the malignant form of follicular carcinoma, right? So FNAC is not useful. It's very important. It has come in your exam. You miss my banter. Okay, so papillary, remember it is associated with radiation exposure. You can see orphan ani nuclei and presence of dystrophic calcification shows you samoma body, right? And very aggressive, poorest prognosis. This has been asked as a one-liner. And medullary thyroid carcinoma, there is a RET mutation. So loss of function, right? RET gene mutation. Calcitonin is the marker and amyloid deposit. Okay, amyloid deposition is ACAL, right? Very good, very good. Red 10 men. Okay, yeah. Red gene on chromosome 10th and medullary. It is seen in men syndrome also. Yes, very good. What about this one? Can you tell me out of all of this, which is this associated with? Iska bata do. Is it TB? Because see, the center should show you caseous necrosis, right? But if I have, can you see these cells? These cells are your epithelioid cells. So can I see epithelioid? This is a granuloma, by the way, guys. This is a granuloma. Okay? And I do not see caseous necrosis here. Or these cells would have gone from the middle, right? Okay, so this is non-caseating necrosis. And which out of the following is non-caseating? Remember your sarcoidosis? Yeah, TB देखा तो TB ही mark करना है क्या? ऐसा है क्या? TB is caseating. Okay? Caseating. And here this is sarcoidosis because it is non-caseating. Can you see the epithelioid cells in the middle also? Very, very important. Right? Very, very, very important. What about this one? Can you see here sarcoidosis? Sarcoidosis, it shows you a star inclusion, right? Yeah, very good. Inclusion of asteroid bodies. Yes, asteroid bodies. Where are stellate bodies seen? Anybody? Do you remember? Stellate body. And somebody was telling about gallium scan. Gallium scan? Yes, yes, very good, Chiranjeev. Very good, very good. I'm so happy with you. Yes, asteroid bodies are also seen in sporotrichosis. Okay, trichosis. You remember sporotrichosis with the linear lesions? Yes, yes, yes. So gallium scan pe, you see this panda sign. Okay, you see this panda sign, right? And also, do you remember Schaumann bodies? Okay, made of calcium and proteins. Schaumann bodies made of calcium and proteins, and also this lymphadenopathy, bilateral hilar lymphadenopathy. Also lupus pernio. It is a kind of extra pulmonary manifestation, right? Lupus pernio. It is associated with your, yes, hilar. Very good. So these are some images of your sarcoidosis. Very, very important. Now look at this question. I don't think you need this thing for this question. Just by looking at the image, can you tell me what is this image of? Very good, very good. This is asbestosis. What are these? I used to call them sheikh kebab bodies. So yeah, they are asbestosis. So do you remember the most common malignancy in asbestosis and what is the most specific? Most common is adenocarcinoma. Right, yeah. Most specific is, yes, mesothelioma. Very good. And these are the ferruginous bodies that are seen, right? Ferruginous bodies that are seen. Silica, you remember, it is associated with TB. Very, very important finding. It is associated with TB, silicosis. And out of them, which is the most important? Silica is the most important. Silicosis is the most common, right? And it shows you eggshell calcifications. Can you see on the hilar? With hilar lymphadenopathy, it shows you eggshell calcification, right? And crazy pavement pattern, right? What is affected here? Upper lobes are affected. Very good. Upper lobes are affected. Upper lobes are affected. What about asbestosis? Lower lobes are affected. Very, very, very important. Okay? All of them are important points to remember. And coal workers, it's not basically, yeah, it is not an occupational, yeah, this is mostly a hypersensitivity, right? Okay. What about this one? This, can you see the coal inside the alveoli, the deposition of coal? This is your coal workers pneumoconiosis. Can anybody tell me about byssnosis? What is byssnosis? It is in complete mole. Snowstorm appearance is seen in complete mole. Cotton, okay? Remember, this is hypersensitivity. Yes. Yes. Yeah, silica shows you snowstorm. Very good, very good. And bagasosis, it is sugar. Is sugar. Okay? Sugar cane. Yes. Sugar cane. Very good. Love you too. Yes, I miss Perm. It was such a great experience there. Thank you. Thank you so much for coming, Sandhya. Thank you so much. Means a lot. What about this? Now, just looking at the keep words, African with the jaw mass translocation of 818, 814. ठीक है 8-14 तो 14 से बहुत कुछ याद चीजें याद करने के लिए मिलता है ठीक है सो यस सीमिक म्यूटेशन दिस इज योर बर्किट्स लिम्फोमा वेरी गुड दिस इज योर बर्किट्स लिम्फोमा बर्किट आ गया लिम्फोमा तो बर्किट्स लिम्फोमा वेरी वेरी इंपॉर्टेंट सीमिक म्यूटेशन है ओके इट इज अ गेन ऑफ फंक्शन हियर या ओके तो सीमिक म्यूटेशन है EBV से associated है very very important EBV is also associated with nasopharyngeal carcinoma NPC this question has been asked many times okay these are the genetic mutations there is jaw swelling and most likely associated with African population right and you see this starry sky appearance okay can you see this starry sky appearance yes from China very good very good acute myeloid leukemia, I need you to remember these points. They're very, very important for your exam. Okay, they're important for your exam. EBV, okay, okay, yeah. So M2, remember it is associated with chloroma that has been asked in your exam. What about M3? It has the presence of ore rods. Can you see these rods? Okay, in this faggot cells. Right, these ore rods Anjali, hello, hello, hi, hi. Yes. Stop. Okay, yeah. So AML 7, again, this is a previous year question. It has been asked. It is seen in Down syndrome. Okay, it is seen in Down syndrome, associated with Down syndrome. One time this image was given to gum hypertrophy with 4 and 5. Okay, AML 4 and 5. Very, very, very important. All right. Look at this question now. ये कौन है अंजलि क्या हो गया है आपको आप ठीक हो yes that's what I said both 4 and 5 are associated both 4 and 5 are associated ठीक है yeah right so if you remember there's a necklace here Casal's necklace that is seen ठीक है Yes, there are 4 Ds here. What are the 4 Ds? First, there is diarrhea, dementia, dermatitis, and if not treated, it leads to death, right? It leads to death. So I want you to remember this. What is so this is known as pellagra, and it is due to vitamin B3 deficiency, right? Vitamin B3 deficiency. Which is vitamin B3? Niacin, right? Niacin, very very important. Yeah, and pellagra-like symptoms can also be seen in carcinoid tumor, where you have an increase in 5-HT, right? It can also be seen in Hartnupp's disease, where you have a deficiency of phenylalanine. Okay, and pearl of necklace appearance is seen in PCOD, right? PCOD. Okay. Yes, 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 yes. Hartnupp's disease, it is tryptophan. And tryptophan only gives you niacin, melatonin, serotonin, right? Okay. What about scurvy? Scurvy is due to vitamin C. Beriberi is vitamin B1 and rickets is D, right? Rickets is D. Okay. I am Sara, ma'am. So this is a table. Please go through this. Okay, very, very important. Vitamins is a short topic in your exam. 100% short question. It will definitely come. Hymen, you know it causes beriberi. It is divided into wet and dry. Please go through. Can anybody tell me where is cardiomegaly seen? Wet or dry? Okay, it's very, very important. Wernicke's, you have that Goa wala thing, right? So you have global, yes, global confusion, ophthalmoplegia, and ataxia, right? Very good. What about riboflavin? Again, it's involved in ETC. Also, you see angular kilosis there. Niacin shows you pellagra. Pantotenic acid, remember, it shows you burning foot syndrome. Biotin, it is involved with alopecia. Also, uh, biotin, there was a question in NEET PG. Evidin inhibits biotin. Okay, very, very, very important. Thank you, Pooja. Thank you, thank you, thank you. Thank you so much. Thank you. You guys are crazy. You guys are very, very sweet. And I am so happy that you came here. It means a lot to me. Honestly, it means a lot to me. I wish, I wish, uh, yeah, leave it. It's okay. Pyridoxine, very important. Peripheral neuropathy से associated है. Also, isoniazide inhibits pyridoxine. Okay, it it's very important. You remember isoniazide is used in TB. So whenever we use isoniazide, we supplement it with pyridoxine. Very important, right? And it can lead to microcytic anemia. Yes, yes. Okay, very good, very good. And B12, how do you differentiate between B12 and B9? Remember, B12 will show you an increased levels of methylmalonyl and there will be neurological symptoms. What about B9? Normal methylmalonyl levels associated with NTDs, right? NTDs. Very, very important. Okay? Yeah. Thank you. Yeah, raw egg, evident. Very good. And vitamin D and C, you all know about vitamin D and C. Vitamin C पे इतने question आए हैं. Firstly, it's involved with iron absorption. Okay, it increases iron absorption. All right, it helps in collagen synthesis. So these are very important points that have been asked in your exam. It is an antioxidant. You remember your antioxidants? Yes. ACE, right? Yes, yes. So if there is a vitamin D deficiency, it leads to bleeding, scurvy, right? And in scurvy, you see this white line of Frankel. Okay, this dense sclerotic epiphyseal ring. Okay, so this is your Wimbergen's ring. This white link of Frankel is a dense sclerotic line. You also have Pelkin's fracture. Here, can you see cupping, fraying, and splaying in vitamin D deficiency? Okay, cupping. What shape becomes cupping? Then irregular edges is your fraying, and splaying, right? Splaying. Very good. This is seen in vitamin D deficiency, rickets. What about this one? Can anybody tell me this? What is this? Just by looking at the image. Just by looking at the image. Okay? Yes, this is your bite cell. Okay? Also, you see Heinz bodies. So, this is nothing but G6PD, right? G6PD. Okay? It is a hemolytic anemia, right? Hemolytic anemia, G6PD, bite cells. You also see Heinz bodies. All right? You remember Heinz bodies? Yes. What about PNH? It is an acquired autolytic autoimmune hemolytic anemia, right? Yes. You see, yeah. Okay, okay. Acquired. This one is acquired, right? There is a big gene defect, right? PD 55 and 59 are involved. Very important. Okay? Autoimmune shows you the presence of spirocytes, right? And there is warm and cold. Which IgM is involved in warm, yeah, cold. Yeah, very good, very good. So remember these are very important points. What about this one? Can you see? Yeah, tell me about this one. Yeah. A 25-year-old sexual health clinic with the frothy greenish vaginal discharge. She mentions discomfort while sexual intercourse. Image is given. Can you see what is this? This is your strawberry cervix, right? And this is caused by Trichomonas vaginalis. Yes, very good. Trichomonas vaginalis. So remember one question that was asked in your exam about this. One question that they had asked was about the cystic stage. Remember? Hare? Thank you so much. Thank you. Thank you. Cystic stage is not present. Only trophozoitic stage is there. Okay? Okay? This was asked in your exam. ऐड लग रहा है ऐसे और लाइव क्लास में भी ऐड लग रहा है वाह वेरी गुड तो क्या करें इसका मैम की आवाज़ नहीं है अच्छी आई एम सो सॉरी आई डू नॉट सिंग मैं ज़रूर शायरी ज़रूर करती हूँ पर गाती नहीं हूँ ठीक है या और आप सो मैं चाहूँगी क्या कि आप सो जाओ मेरी क्लास में हाँ ओके so what is the drug of choice for trichomoniasis? It is metronidazole. What about bacterial vaginosis? Also remember bacterial vaginosis also shows you what is the drug of choice for that? It is metronidazole for bacterial vaginosis as well. And what image do you see? Do you remember about bacterial vaginosis? There is a change in pH, right? Clue cells, yes. Clue cells are clue cells are seen where the gram-negative bacteria are adhered to the epithelial cell, right? You have this epithelial cell and the gram-negative bacteria are adhered to it. Okay? And use the criteria, Amsel's criteria, right? शायरी सुनाओ. आपको पढ़ना नहीं है मेरे साथ, शायरी सुनना है. अच्छा, कुछ भी. Okay, what about candidiasis? Candidiasis. So these are vaginitis. There are 3. Okay, and PID. These 3 plus PID. Please go through them. Very, very, very important for the exam. Clue cells, pH more than 4.5, whiff test. Matlab that fishy odor should be there, right? Okay. What about the discharge? If it is curd like curd rice जैसा है, तो it is candidiasis or taste, yeah, curdy white discharge, right? And greenish है, greenish discharge, then it is trichomoniasis. Which partner will you treat? Which partner will you treat? तो किसका किसके पार्टनर को ट्रीट करोगे? मैंने पूछा चांद से कि देखा है कहीं, मेरे सारा मैम से कहीं, चांद ने कहा, चांदनी की कसम, नहीं नहीं. अरे वाह, वेरी गुड. तुम लोग भी शायरी करते हो? हाँ चलो, अच्छी बात है. चलो 5 minutes break. No break, no break. We will finish the session. But glad to know कि इतना. Remember, trichomoniasis is a STD. It is an STD, so you always treat the partner. So this female, she has been having frothy, itchy discharge, discomfort with sexual intercourse. So इसको तो treat करना ही है, इसके partner को भी. Okay? Partner को भी. No. I was not going to give you a break. I was like, let's talk. अभी बहुत हो गया, बात करते हैं, वैसा बातचीत करते हैं, वैसे type of break. Not break. Break कौन? क्या 2.5 घंटे का स्टैमिना? ऐसा थोड़ी होता है. डॉक्टर स्ट्रेंज ने सही बोला. या मैम आप टाइगर ही है ना वो. या नाउ लुक एट दिस, यू कैन सी दिस पोर्ट वाइन स्टेन and distribution with trigeminal nerve. Yeah, very good. This is your Sturge-Weber syndrome. What has happened in Sturge-Weber syndrome? I should try singing. मैं बहुत सारे काम करती हूँ, but I have a habit of doing it well. What I don't do well, I don't do that. ठीक है? So I know singing, like it's there in my family, but I देखो मेरे साथ क्या हो गया पता है? We are 3 sisters, okay? Both my sisters have dimples, and I didn't get dimples. Like my mother was like, नहीं, तू जा. They have great voices, they sing, but मुझे नहीं मिला. Their hair is like ऐसे उड़ाते हैं. मुझे मतलब, but I have yeah, and they're both very very cute. मैं रह गई. तो I have a lot of problem with my mother. Okay? Yes. So NF1 and NF2, remember? Pulmonary, what do you say? In the iris, you can see the hamat. Yeah. I got, like my sisters are more prettier than me. Yeah. So I keep telling my mom that सब तो आपने दे दिया पर brain मुझे दिया. Okay? Yeah. So these are your Lish nodules. And yeah, cafe oli spots आपने already देखा हुआ है. Thank you so much. तो ये सब बोलना पड़ता है ताकि आप मेरी तारीफ करो. Right? Thank you. Matters a lot. तो ऐसे बीच में ना, actually before I used to, एक पहली वाली सारा देखते ना आप, तो मैं बहुत अलग थी. Like I was always so. तो अब थोड़ा calm down, very ऐसे. Okay. So now look at this, tuberous sclerosis. You see I want to tell you. Okay, I want to tell you about Sturge-Weber syndrome. Remember, this is a trigeminal encephalomyelitis vascular malformation, right? And what are the things that you see in this? Yes. Yeah, what are the things that you see in this? You see an ash leaf macule, you see chagrin patch. Can you see this? Yeah. And कितने दिन का सेशन होगा ये देखते हैं, मैं बताती हूँ आपको, ठीक है? All right. Let's go to the next question. Look at this question. So what can you see here? What can you see here? You can see these. Yeah. Okay, very good. So you can see these comodones, right? Comodones which are open. Okay? Comodones which are open. These are comodones. They are grade 1 acne. So I just want to show you this table. Grade 1, remember, it is comodones. Grade 2 is papular form of acne. Grade 3 is pustular and nodulocystic is grade 4. When you look at the treatment, this was asked in your exam. Even this was asked in your exam. So look at the lesion and you should be able to tell the treatment. Okay? Thank you, KK Brain Wale. KK. Who are you, KK? Yeah. So topical retinoids like adapalene can be used here. Okay? Remember, these are whiteheads. If they are closed comodones. If they are open, they will become black. Okay? What about papules? Raised lesions less than 1 centimeter. Right? Raised lesion less than 1 centimeters. These are pustules. And then you can see this nodulocystic acne, oral retinoids, isotretinoin. And isotretinoin, if you remember, isotretinoin is teratogenic. And even this question has been asked in your exam. Thank you, do it with purpose. Okay. Okay, so this is teratogenic. Okay, remember? Teratogenic, yes, very good. It is teratogenic. And can you tell me what is the most teratogenic drug out there? If you remember, it is sodium valproate. Okay, sodium valproate. All right, sodium valproate. So this is the other question. She was planning to get pregnant. Remember, you have to stop your isotretinoin usage 28 days before you're planning to conceive. Okay, 28 days before you're planning to conceive. So neural tube defects present with sodium, they're known to present with sodium valproate, which is the most teratogenic. So what can be given in pregnancy instead of sodium valproate? Can anybody tell? Very, very important question again. So you can give something known as lamotrigine or levetiracetam, right? Lithium causes it causes box-shaped heart, right? Lithium should be avoided. But yes, yes. Lamotrigine, yeah, levetiracetam. Right? Okay, very good. What about this one? Can you see? Can anybody tell me? Ovarian cancers presents with difficulty like climbing stairs, getting up from the chair, combing hair. Okay? Yes. Can you see there is this rash around the. Yes. This is known as a heliotropic rash. Heliotropic rash. Okay? Heliotropic rash. This rash is seen in. This rash is seen in dermatomyositis. Okay? Dermatomyositis. We've already discussed systemic Cushing's disease. Yeah, Gottrin papules on the knuckles. You can see these are the Gottrin papules on the knuckles, right? What about Scholl sign? This is your V sign where you have erythematous macular rash on the anterior neck. And then on the back, upper back, you can see the Scholl sign. All right? All these signs are seen in dermatomyositis. What about this one? So this is a very classical case of sparing the nasolabial folds. See, all these questions are the clinical features are very important. That's how you identify them. Okay, so this is SLE, right? This is SLE. Melasma we have already discussed. All these we have already discussed. So most these are important. Please go through the antibodies. Usually in SLE or connective tissue disorders, they want to know your antibodies. They want to know the antibodies that are involved. Okay, so most sensitive, we all know it is anti-nuclear antibody. Yes, butterfly rash is seen. That's the rash they were talking about, butterfly rash. Right? So this is, all these antibodies are very important. Neonatal lupus was asked in your exam. Antihistone, we covered this in that table as well, right? So you can see this butterfly rash pairing the nasolabial fold, and chronic cutaneous lupus will present with discoid lesions. Okay, very important, has been asked in the exam. Okay, has been asked in the exam. Okay, let's go to the next question. This truck driver is very famous truck driver. Keeps coming in the exam. Can anybody tell about this Turkey truck driver? इसको ये आता रहता है, ये हर बार आता रहता है, ठीक है? तो एक ट्रक ड्राइवर था, ओके? So complains of a painless indurated ulcer after unsafe. So why is it a truck driver? Have you ever thought? Yeah, okay. Anyways, so the diagnosis is primary syphilis, because primary form of syphilis. Yes, very good, very good. And it can be seen on dark field microscopy. Very good, very good. It can be seen on, actually truck drivers, they go through a very long distance now. मैं बहुत move करती हूँ, I'm sorry. Okay, they go through a very long distance, and that's why what do you say? They're always away from family. तो वो बाहर family बना रहे हैं, right? So dark field. This table again, very 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 important. Okay, very 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 important table. Yeah. Night में जाते हैं, बहुत अच्छा mnemonic है. Okay. So treponema, it's caused due to treponema pallidum. I want you to remember this table: syphilis, LGV, chancroid, and donovanosis. Uh, remember about this one. This is, everything else is painless except for this one, where there is a multiple painful ulcers. Okay, chancroid, with respect with Haemophilus ducreae. All right, and remember, it is where do you see? So chancroid. Also, we talked about HSV, where genital ulcers were painful. Okay. Yes. बर्किट हो गया अंकित, बर्किट हो गया, बर्किट पढ़ाया था मैंने, स्टारी स्काई, वो बर्किट के बिना क्वेश्चन ही नहीं बनता, राइट? ओके, so in your syphilis you have a single painless indurated ulcer. Remember, the lymph nodes are bilateral. All right, very good. LGV, painless. Hemophilus, it is painful. Okay, also hemophilus में कौन सा appearance दिखता है? Can anybody remember the appearance? Safety pin. Yes, very good, very good. And donovanosis, remember, beefy red ulcers that bleed on, and you also see Donovan bodies, right? Donovan, very good. There is a school of fish appearance. School of fish appearance. Yes, school of fish appearance. Yes. So now look at these images. This is that painless indurated ulcer. This is the dark field microscopy that we talk about, dark field microscopy. Okay. Dark field microscopy. This is the maculopapular rash that is seen in secondary syphilis, right? Acuminata and lata. See, when I showed you acuminata, you saw HPV is the one that causes acuminata. Okay? So did you see the lesions were cauliflower-like, right? Cauliflower-like lesions, right? Cauliflower-like lesions. But when we are talking about lata, right? Lata is seen in secondary syphilis, and they are more papular in nature. Okay? Papular. तो अगर रफ होंगे cauliflower like होंगे, that is your acuminata. And if it is papular, more round around the anus, then that is lata. Okay, so it is seen in secondary syphilis. Got it? And also you see this moth-eaten alopecia. All right, very good. Did you understand? And who asked that? Yeah. So this is lata. This is your. I'll just mark it. It is your condyloma lata. All right. Okay, very good, very good. And tertiary syphilis presents with gamma formation and neurosyphilis, right? Also this, can you see this beefy red ulcer and Donovan bodies here? Okay, these will have the safety pin appearance. Okay, acuminata was in the exam, very good. Ma'am, आपको हंसी आ रही है लेकिन आप लोग ठीक है चलो चलो. This is the beefy red ulcer that is seen where Klebsiella. Very good. It is seen in, yeah, donominosis. All right. फटी पड़ी है क्यों क्यों क्यों? Tell me why. आपने कर लिया ना जो आपको करना है? पढ़ लिया ना? See, 10 days before the exam, if you're going to be scared, I always tell this, be there for yourself, okay? You have to be there for yourself. Leave your friends, leave your family, leave everybody. But when you've worked so hard and you have only 10 days left, and these 10 days decide a big percentage of your exams, okay? And you have to revise all 19 subjects, all right? When please make sure that you utilize these 10 days and make sure that you're motivated. Be there for yourself. Look at yourself and be happy. You've done your part, yeah? You've studied, you've attended classes, you've given tests, you've given mock tests. So many of you message me telling ki ma'am ye mock test aaya. You know, there are students who don't even who give their first exam in FMG. If you're that student, you will still pass, but let's, yeah, so that happens. It's fine. Why palpitations? Why? It's okay. You did your part. Whenever you feel like, you know what, maybe I cannot, you stop yourself right there and tell, I will pass, okay? No matter what, I will pass. There is no one who can stop me. I will pass. All right? If anybody tells you in the world ki something will happen, what if? Just run away from them. Stay away from negative energy right now. Just be motivated, and whenever you feel like palpitations or something, text me, okay? So don't worry, it's fine. You be there for yourself, everything will be fine. See, your mind, your subconscious, have faith in yourself, be there for yourself, okay? Your subconscious knows the right answer. Has this happened to you where I know this answer, but I don't know why? So that means that somewhere in your mind that answer is there. So have faith in whatever you have done, your preparation, have faith in that, and don't leave yourself at the last minute. You should be there for yourself. सबसे ज़्यादा, ठीक है? Don't worry, it'll all be fine. And हम तो है ही आपके साथ. Okay? I am there with you. How can you not pass, man? How can you not? All right? So what is the answer for this one? Let's come back. What is the ठीक है, कॉन्फिडेंस, लेकिन खा ना खाए मैम उदास हो जाते. उदास क्यों? Why are you thus? Why? You should be happy. You should see. I feel happy just by looking at myself. I had there was a point where I had an accident, okay, and then my whole face came down. So I feel very happy when I see my face. I'm like, I can smile, and you should be happy whenever you see yourself. अरे तू तो तू तो भाई कर लेगा. It should be like that. Whenever you look at yourself in the mirror, it should be like, अरे तू तो कर ही लेगा आजकल. So that should be the motivation, okay? You should be there for yourself. I am my biggest motivator, and you should be your motivator. And go write the exam with a lot of every day at these last 10 days. Make sure that you have a whole criteria, right? You're making sure that you're going through all the topics, all the most important points of all 19 subjects again. That is very important. These last 10 days decide your how much you can recall on the day of the exam. Okay? एक मूवी देखने का मन कर रहा है, पटेल ऐसे पढ़ ले. Okay? Yeah, your topics are enough. I am trying to do the most important topics. Go through them, but you should have your own last minute topic or something last minute that you can go run through, okay? And you have highlighted the points of your notes. Please revise them again. See, your biggest memory will be your own notes, which you have touched, felt, looked at. ठीक है, वो सबसे ज्यादा याद रहता है जो आप खुद करते हो, राइट? किसी और का आपका याद रहता है आपको हमेशा. ठीक है, चलो चलो, लेट्स गो टू द नेक्स्ट. Yeah, whenever there is calcification, remember it is CT scan, and these are some. memory loss नहीं हो रहा है. Okay, it will finish now. Okay, it will finish now. We will finish in some time. All right. So these are some investigation of choices. Very, very important. This has been asked. CT pulmonary angiography for your pulmonary embolism has been asked in the exam. Okay. So make sure that you go through this. This is important. Some investigation of choice. I will try to add more. All right. And I'll see that you get them. This one, see, everybody knows this. ये क्या है? थोड़ा मैं Achalasia cardia, what? Yeah, manometry is the very good investigation of choice. All right, what is this? Yes, so EDH, this is your extradural hematoma, and it is caused due to the middle meningeal artery, rupture of middle meningeal artery. Thank you ABCD. आपका नाम क्या है? कुछ याद नहीं है, मैंने बोला ना. And look at this table. All right. This table is very important for the exam. See, extradural hemorrhage, what is the source? It is middle meningeal artery. Happens due to trauma to the pterion. Okay, and lucid intervals are seen. You remember lucid intervals? He gets up, falls back again, gets up, right? Lucid intervals are seen. You see a biconvex hyperdense, and it does not cross the sutures, right? It does not cross the sutures. Subdural hematoma, we already saw the banana-shaped hematoma, right? Rupture of bridging veins. Here what happens? Sutures are crossed. Okay, sutures are crossed. Very important, right? Very important. Subarachnoid hemorrhage, if you remember, it is the worst headache of my life. It is, yes, it is the worst headache of my life. It is this thunderclap headache that I'm going to be having, right? It is due to the rupture of aneurysm, berry aneurysm, all right? And intraparenchymal bleed, most common place is putamen, okay? And most common cause is hypertension. Thank you. I love Bhanu sir's team is so amazing. Itne pyare log hai. They have taken care of me like anything. I swear I couldn't even talk. And they are making ginger tea and coffee and giving me Vicks. They ran away and got Vicks for me. Yeah. So yes, a very wrong time to get a sore throat. All right. Yeah. So what about this one? Intraparenchymal, remember systemic hypertension. I'll just show you the images. This is your, can anybody tell me which one is this? Can you see this? This is SDH. What about this one? This is your put him in bleed, right? Intraparenchymal hemorrhage. Yes, very good. And it is hyperdense in nature, right? Infarct will be hypodense. Yes. So this one is your, yes, SAH. And if you remember this on MRI, CT appears normal, but MRI में you can see this traumatic lesions, right? Multiple lesions. And MRI is the investigation of choice of what condition? Diffuse axonal injury, where the prognosis is very bad, right? Yes, yes, yes. Very good. Yes, very good, very good. Walaikum assalam. Yes, okay. So remember, what about this one? Can you see this boot shape here? अरे वैसा नहीं it thank you so much ABCD what's your name? Yes, okay. So this is your boot shaped heart, and if you can see what boot shaped heart is seen in tetralogy of Fallot, and tetralogy of Fallot is seen in DiGeorge syndrome that was asked in your exam. Yes, trauma, very good. Diffuse axonal injury, bhavna, very good. Okay, DiGeorge syndrome. It was seen in DiGeorge syndrome. Epstein anomaly, if you remember, you see box-shaped heart. Okay, box-shaped heart. This is the snowman appearance. What about egg on string? This will show you egg on string. So if you can see, this is the egg on string. This is your snowman appearance. Yes, the figure of 8, snowman appearance. And if you can see, this is your figure of 3. An inferior rib notching can be seen. And this is seen in coarctation of aorta. You remember? And this is your box-shaped heart. Yes, very good, guys. Very good. What about this one? A child presents with recurrent infections. He has a reduced platelet count and a skin rash as shown in the image below. What is the diagnosis? So reduced platelet, skin rash, and a history of recurrent infections make a triad. Thank you so much. Thank you. इतनी तारीफ भी अच्छी नहीं लगती. Yeah. Uh, so sweet, so sweet. Thank you so much. It's a privilege to be teaching all of you. It is truly a privilege. I am very, very blessed. Okay, Hinosh-Schollin का triad अपन को पता है. Remember normal platelets? We just discussed normal platelets होते हैं. All right. What about Job syndrome? This is a hyper IgE syndrome. Okay, IgE syndrome. Very, very important. ठीक है. Bruton's A gamma globulinemia, it is a BTK gene defect. Happens in boys, if you remember. And Viscott comes with a triad of what? Low platelet, small platelets. It has thrombocytopenia, which is because of the defect, small platelets. It's the only condition with small platelets, right? Recurrent infections and rash, right? So everything is given here. Just go through this, right? With your purpuric rash. Hinosh-Schollin we have already covered. X-linked with wasp gene defect. Bleeding platelets because of the small sized. And Job is a STAT3 gene defect, right? STAT3 gene defect. Thank you so much. Bruton's A gamma globulinemia. If you remember, A means absent. All right, absent. Most common in boys. Okay, and it is a B cell defect. So gamma, because B cell is absent, then that's why the antibodies are affected, right? नीट पीजी यार पता नहीं खेल ले रहे अपने साथ. मतलब आई रियली फील दैट इज सच अ जुलाई एक साल पूरा मतलब मेडिकल इज सच अ टफ प्लेस टू बी ना. ना आप शादी कर सकते हो, ना आपसे लड़का पटता है, ना. इट इज सच अ टफ प्लेस टू बी. कुछ सही नहीं होता मेडिकल में. Everything happens late. Yeah, results in defective opsonization. Okay, PTK gene defect. Remember the word B. B, Bruton's A gamma globinomia because of, yes, all B. B cell defect, PTK gene defect happens in boys and results in defective opsonization. Do you remember your opsonins? Do you remember your opsonins? What are your opsonins? Anybody? What are your opsonins? Yes, C3b, FC region of IgG. You remember this? Very, very, very important. And some other CRP and all that. Right? So because you don't have this antibody, that's why there is defective opsonization. What is opsonization? Anybody, what is opsonization? It is coating of the bacteria, right? Why मैं बोलती हूँ उसको कपड़े पिनाने का, right? Okay. What about this one? Which drugs are used in the given image? Can anybody tell me? Yes, making bacteria tasty. So, like कपड़े पिना के उसको अच्छे से bacteria is like, हाँ मैं आ जाता हूँ. I remember it like that. Okay. So this one is the guy winking at you because you think you're hot? Nahi. There is ptosis here, right? Ptosis. And what happened here? Yes. So a drug was given, which is used in something known as the tensilon test. Okay, tensilon test, and that is used because it is very short acting, right? It is very short acting. Yeah, we don't use it anymore, but this was asked in the previous year question. Yes, now we have ice pack test. So you can just put and right away you will come to know. And this is, what is the diagnosis? It is myasthenia gravis, which is a type 2 hypersensitivity. Type 5, if you can find it in the options. Okay. What is the drug of choice? Neostigmine, yeah, pyridostigmine. With atropine, right? Always with atropine because you want to block M1, M2, M3, right? Okay, very good. And atropine is the drug of choice for? Atropine is the drug of choice for which poisoning? OP poisoning, right? Very good. Thank you so much. What about this one now? Very important question. Organophosphate and carbamate poisoning. Very good. What about this one? So look at this. This is a male meat transporter presented with a pustule on the head, later progressed to an ulcer. What is the best stain used for? So if you look at this, the diagnosis is cutaneous anthrax, right? Cutaneous anthrax. Because this is nothing but Hyde-Potter's disease, right? You remember all these dead meat in the olden ages, they used to take it at the back, and usually they got a black scar at the back, right? Yeah, Hyde-Potter's disease. All right, and this is seen, how do you stain it? With Loeffler's methylene blue. And there's a reaction for that because it's capsulated. The capsule is made up of polypeptide. You remember? All these questions have been asked. Okay, that is known as McFadden's reaction. I'm going to... So Bacillus anthracis, remember it is gram-positive bacilli. You remember your gram-positive bacilli? They are very important for the exam. And it's capsulated. The capsule is made up of polypeptide, very, very important. And Loeffler's methylene blue is used to stain that capsule. That is known as McFadden's reaction. Why will it be carbonyl fusion? We are talking about anthrax now. Okay? Anthrax hai na? Anthrax se this is related. Loeffler's methylene blue. Okay? What about on gram stain? You will be able to appreciate bamboo stick appearance. Okay, bamboo stick appearance. All right. Also, on the blood agar, you can see these colonies that show as pearls. Okay, medusa head appearance or matted pool appearance. Okay, or a pearl appearance, right? Plus, on gelatin stab, you can see this inverted fig tree appearance. This is your painless cold cutaneous anthrax. Okay, black scar. They keep talking about this. Okay, what about this one? It progresses to become this malignant pustule. Okay, it is a feature of cutaneous anthrax. Very, very important. All these points are important. See, just one slide and all the important points are there. In pulmonary anthrax, everybody knows it is known as Wool-Sorter's disease, right? It is known as Wool-Sorter's disease. We will end in 5 to 10 minutes, right? Okay. What about this question? Can somebody tell me about this? ये mix bag है and I have done पूरा question नहीं दिख रहा. A patient presented with complaints of watery diarrhea, stomach pain since he consumed meat for lunch. The physician sent him for samples, testing to confirm the organism. The microbiologist reported that the organism is capsulated, non-motile, and has a subterminal spore arrangement. What is the most likely positive organism in this? Which one is the most positive? Yes, very good. It is Clostridium perfringens. Okay, Clostridium perfringens. Yes, associated with meat. Very good, very good. Clostridium perfringens. What about Clostridium perfringens? Firstly, remember the media that is used, it is Robertson cooked meat media, right? And they show a slow swarming type of motility, which is known as stately motility, right? Also, this, can you tell anybody, can you tell me? Clostridium perfringens is also associated with, you can see ecchymosis with this gas, with this gangrene. Okay, so this is the gas gangrene, and Clostridium perfringens is associated with that. We have something known as ophistotosis, which is associated with botulism. All right, and that happens due to canned food. And you remember, food poisoning is very, very important. Firstly, food poisoning of IP 6 hours. Can anybody tell me which two food poisoning are we concerned with when the incubation period is 6 hours? Can anybody tell me when you? Yes. So we are talking about Chinese fried rice and milk products, right? Bacillus cereus and Staph aureus, right? IP is 6 hours. Yes, very good. And Chinese fried rice is Bacillus cereus. Canned food, remember, it is botulism. Okay, food poisoning due to canned food. All right. And milk products, yeah, meat, that is Staph aureus. So many times this question comes. Okay. So make sure you remember about food poisoning and what happens due to food poisoning, you know, diarrhea. And we have those different types of diarrhea. Go through dehydration also, very important for the exam. Okay. So Chinese fried rice happens due to bacillus. Okay. Pseudomembranous colitis, you know, Clostridium difficile due to antibiotics. Like, which antibiotics cause pseudomembranous colitis? So you can see all these gross yellowish nodules, right? These are seen in pseudomembranous colitis because of long term of cephalosporins. Yes, clindamycin, cephalosporin, right? Clostridium difficile due to Clostridium difficile. Can anybody answer this question now? Very, very important. The triads. Hmm. Yes, it is congenital rubella syndrome, right? Congenital rubella syndrome. प्यार में अंधा बहरा रूबेला। आप लोग बहुत अच्छे हो। I actually remember rubella like this. Okay, okay. So rubies, you can't see rubies, you can't hear bells, and heart defect, which is PDA. Okay, so I remember it like that. I'm a very innocent person, but प्यार में अंधा बहरा बच्चा तो मैं नहीं भूलूंगी। Okay, प्यार is heart और अंधा बहरा, very nice, very nice. प्यार में अंधा बहरा बच्चा, ठीक है। पर बच्चे को इतना जल्दी प्यार, ये किसी गोट टीचर ने पढ़ाया था। Okay, okay, that's very good. I remember rubella like this. See, there are different mnemonics for different things. You can remember as you want. Yeah, amazing, amazing. I am a big fan of her too. Okay, I've learned from her too. I always respect her. Like amazing, just amazing. Okay, so yeah, rubella. Then what about the other triads? Can you see which is this triad? This is your, देखो ये क्या है? Yes, very good. This one is your congenital syphilis. Yes, congenital syphilis. So you have a triad of the Hutchinson's teeth, interstitial keratitis, and deafness, right? What about this one? Congenital CMV. You remember congenital CMV presents with microcephaly, chorioretinitis, and periventricular calcifications. Okay? Microcephaly. Can you see on the lateral ventricles? Can you see this calcification? Yes, very good. It's fine. सब हर कोई किसी और का टीचर होता है, ठीक है? So I am happy to know. All right. Yes. So congenital toxoplasmosis. What is the triad? Chorioretinitis, hydrocephalus, and intracranial calcification. Okay? Intracranial calcification. ठीक है? What about this one now? I think I don't need to show you the question. Just looking at it, what can you tell me? Very good. This is a keloid. Okay, this is a keloid. Very good. This is a keloid. So dermoid cyst, if you remember, this is nothing but the benign tumor of ovary. All right, teratoma. It involves all three germ layers, right? Three germ layers. This has come in the exam. Very important, right? And even the image has come. Hypertrophic scar. I will show you. It doesn't cross the bite. Okay, yeah. So if you see, this is a hypertrophic scar and it is within the wound margins, right? Within the wound margins. Very good, very good. It is within the wound margins. What about this one? This is your dermoid cyst. A dermoid cyst, also known as teratoma. All right, you can see because of the all the germ layers, you can see hair, sebaceous gland, right? And this is a table about it. Remember your the question that was asked in this was treatment. In see, firstly, your keloid will not regress by itself. It is most commonly present on the sternum or the earlobe, right? Your hypertrophic scar can be everywhere and it regresses by itself. All right. How to differentiate? Wait, we will do that. I will be taking OB-GYN also. So wait for that. ठीक है? तो यहाँ पर collagen type 1 most commonly is seen with keloid, while type 3 is seen in hypertrophic scar. Okay, no treatment it is required in hypertrophic because it regresses by itself, right? Yes, so intralesional steroids can be given. And this was your previous year question. Okay, this was asked in your exam. What about this one? I think you can tell me, you can see this panda sign appearance. Panda sign appearance, right? Very good, very good. Yes. So which one is this? This is your Wilson's, right? This is your Wilson's. And Dawson fingers you can see on multiple sclerosis, right? What about this one? Can you see this box-shaped ventricles? Can anybody tell me where is this seen? Box-shaped ventricles. Look at the ventricles, lateral ventricles. It has this, yes, this is seen in Huntington's disease, okay? Where you have CAG repeats, right? What about this one? Can you see it very clearly? Yes, CAG repeats are there. What is the answer for this one? Which tumor is it? The presence with recurrent headaches revealed an intensely enhancing mass located around the parafalcine region of anterior. Yes, very good, very good. It is your meningioma. It is your meningioma. See, out of this, they always ask about calcified tumor, right? So your craniopharyngioma, which is present in the Rathke's pouch, that is a calcified tumor. Pituitary adenoma, everybody knows this one question keeps coming about pituitary adenoma, right? It is the tumor of the sella region and it presents with bitemporal heminopia. MRI is the investigation of choice. What about craniopharyngioma? Remember, it shows calcification and it is a supracellular, it is present in the supracellular region, right? Neurocysticercosis, you can see these lesions, right? It is caused by tinea. Okay? Yeah, it is caused by tinea and it is an infection. Tinea solium pock tapeworm, right? Saginata is for cow. Okay, okay. What about this one? This is the last question for today. Over. We are done for today. Okay? Yes. So this took iron tablets, right? What is the antidote for this poisoning? Yes, definitely the antidote will be desferoxamine. Okay? So iron poisoning. And I want you to do me a favor and go through this table. Okay? It holds all the most important drugs that can be over and their antidotes. Okay? Very, very important. Lithium was asked. Okay? Lithium was asked already. And we also had, you know, this question that they have asked many times. So go through this table. Okay, yeah, go through this table. I want you to make sure that you remember all of these. Okay, isoniazide, I just told you, it is always given with pyridoxine. Okay, vitamin B6. This is the last question. I'm so sorry. This is the last question. So just looking at this image, I think you can tell me what this is. It's simple. It is can you see this velvety hyperpigmentation? Yes, this is nothing but your acanthosis nigricans. It is seen in polycystic ovary disease, right? Polycystic PCOD. And polycystic ovarian disease has this necklace pearl appearance, right? Yeah. Can you see? This is the ultrasound. And on the periphery, you can see these follicles, right? They're small, 2 to 9 mm. Oh, okay. So they make a necklace of pearl appearance. Okay, necklace of pearl appearance. Can anybody vote for you, Bhuvana? Yeah. So this, what was the criteria? If you remember, yes, it is the Rotterdam's criteria. What is Rotterdam's criteria? I think you can recall on there should be presence of hyperandrogenism, right? Clinical or biochemical. And what else? Like hirsutism, the voice changes, right? Yes, very good. What else is there? So hyperandrogenism, then 2 to 9 follicles. The size of the follicle should be 2 to 9 or the volume of the ovary should be more than 10 cc, right? Very good, very good. What else? And menstrual cycle disturbances. So this is the Rotterdam's criteria and it should fulfill that. What is the treatment of choice? See, PCOD happens due to insulin resistance, right? So if they ask you regarding insulin resistance, you can give metformin or letrozole, right? Very good, very good. For ovulation, give letrozole. Okay, so we are done. Erythrasma, if you remember, it is caused by Corynebacterium minicitism. Okay, if you remember on क्या बोलते हैं फोटो से अपन क्या देखते हैं ये कोरल red appearance is seen in erythrasma. Please go through that image. All right. So yeah, wood lamps. Okay, wood lamps mein apan coral red. So thank you so much for joining in. Thank you so much. I'm so sorry. I'm usually more energetic than this, but today I swear, mera gala. I don't know what happened, but it was really hard to talk, and that's why it was so hard to lifestyle modification. Himanshu, yeah. So, anyways, thank you so much for coming. Thank you so much for staying till the end, and please let me know. Thank you, thank you. I love you too. I love all of you, and I'm so happy with all of you for attending my sessions. Like we started with I'm happy. Like a lot of you have stayed even till the end, and even though thank you, thank you. It matters so much to me, and I am so grateful, always grateful. So I will always be praying for you. I'm always there, and I love you too. I love you too. Thank you for doing this. Thank you for staying. Before I go, can you please ask any doubts that you have before I leave? I just want to make sure that I'm clear. This PDF will be provided in the Sir Ke channel page. Okay? Please don't ask any personal questions. Yes, please do not ask any personal questions. You can always ask me. Uh, yeah. Thank you. Yes, this PDF will be shared. Yeah, my next session will be on 14th, I think. I'll be taking on 14th. Okay? So we will meet on 14th again. Okay, we'll try to add OB-GYN surgery and all the important highlighted parts. All right, but still, thank you. How do you approach these 10 days? Please take it integrated and make sure you revise all 19 subjects again. See, go through your highlighted parts of the notes, divide them. Like if I was doing a revision, I would divide them into 3 phases. Do anatomy with ortho, radio, okay, these surgery, I would keep them together, and then all the medical subjects together, I would keep them together because I can integrate and I can study them together. Patho ho gaya, physio ho gaya, pharma ho gaya, and medicine, I would put them together. And then biochem pedia ke saath dalti, because a lot of pedia things would have like metabolic errors, ये सब pedia में भी आता है, तो biochem with pedia, ENT, ये मैं साथ में रखती. Okay? See, thank you so much. So make sure that you are 19 subjects को एक और बार ऐसे देखना है, ठीक है? That is very important because you'll forget the points that you're good at if you don't revise. Okay? Yes, maybe PSM surgery and gynae, like combine them together and take one section. Okay? So maybe on 14th. 14th I'll be having session. I'll inform soon. Thank you for attending. Thank you for being there. Let's see you again, okay? And sorry for my energy today. All right? So best of luck. Love you guys. See you. See you soon.